Hindi, Rob, ako ang may problema. Welcome to the RETT online forum entitled Philippine COVID-19 Crisis under the lenses of DRRM or DRR management. Ladies and gentlemen, mga kapatid, simulan po natin ang ating pagtitipon sa isang panalangin na pamumunuan ni Brother John Mel Sumatra ng PhilRads.
Let us pray. Dear Lord, we thank you for this time that we can still be together, even though we have physical limitation. We ask for your wisdom and guidance as we talk about how to face the challenges we are facing as a nation and as a people in the world. We ask for comfort for those who are suffering. We pray for healing for those who are sick. We pray for strength for those who tirelessly serve. And we pray for the enlightenment of every single person who has the power to influence and to serve. We lift your name and glorify you in the midst of all these challenges. Be with us, Lord. In Jesus' name, amen.
Let us hear from our President, Engineer Ornan S. Vicente.
A pleasant and a lovely evening to everyone. We are glad to have you with us this evening as we bring you the RETT-PH special presentation in collaboration with Radio Engineering Circle Inc. and Emergency Response Integration Center or ERIC on Philippine COVID-19 crisis under the lenses of DRRM in celebration of National Disaster Resilience Month. I would like to welcome our guests, and we are very grateful to have them with us tonight. Former DSWD Undersecretary Vilma B. Cabrera, who will share to us her experience at DSWD as the chair of Response Cluster in times of calamities and disasters. Of course, we have former Undersecretary Eliseo M. Rio Jr. I believe there are a lot of our audience who wants to hear you regarding contact tracing. Also, Dr. Ted P. Isguera, the founder of WISAR, a COVID-19 survivor himself, who will share with us how he fought COVID-19. And last but not the least, a very active in posting in our RETT-PH Viber group, Colonel Marlon M. Bayhon, a member of AFP Health Services. Let's hear from the frontliners' point of view on how this pandemic is being contained. We call it special presentation because we really have with us a very special persons or individuals who have different exposures and experience in the respective fields. They will be introduced properly later. And of course, to spice up this event, we have also seasoned individuals who will be our MC. Let's start with the lovely lady, Engineer Mikey Millet Sabat. She is a member of the Board of Trustees of Radio Engineering Circle, Inc. Next is Mr. Christopher Graho of ERIC and our RETT-PH founder, Colonel Edwin C. Sadang. The Federation of Rapid Emergency Telecommunications Team of the Philippines, Inc., or the RETT-PH, is a consortium of Filipino patriots who advocate life-saving missions before, during, and after emergencies. It embraces the spirit of bayanihan in providing emergency communication in disaster zones. The whole of nation approach is the Federation's strategic goal to empower people by strengthening their information and communications technology capabilities during emergencies. ERIC are IT professionals who volunteer their expertise for information communication technology and management before, during, and after emergencies and disaster. The Radio Engineering Circle Inc. is composed of students and professional amateur radio operators, engineers, and technicians. It was founded last September 17, 2016, dedicated to amateur radio, propagate, and radiate. The organization envisages students and professionals driven by the same interests in the provision of excellence and service that would contribute to the advancement of technology in the field of radio engineering. So please sit back, relax, and enjoy the show. Magandang gabi sa inyong lahat.
Maraming salamat po, Engineer Ornan S. Vicente. Maraming salamat po, Mr. President. Sa pagpapatuloy po ng ating forum ngayong gabi, we wish to introduce our first speaker. We know him as the Undersecretary for the DICT, but unknown to many, he is one of those highly talented brains who would squeeze off its intellectual juices to set up the national communications backbone long before the telecom companies erected their first towers. He is also one soldier who, beyond retirement, would continue to fight the country's enemy, which are slow progress, division due to improper communications, graft and corruption, and many more. He is one general engineer whose intellect, honor, and patriotism is something we would be proud to tell our children and grandchildren. Ladies and gentlemen, please welcome General Eliseo M. Rio Jr.
Magandang gabi po sa ating mga kababayan at mga fellow communicators. No? Thank you very much for this honor of this invitation to be one of your resource person. At talaga ho, dahil sa ito'y buwan ng ating maging resilient sa disaster, ay very, very appropriate itong ating ginagawang symposium para ipatupad or ipadating sa ating mga kababayan kung anong ginagawa ng ating advocacy, no? Dahil ito isang disaster talaga, no, na ninararasan what that we are experiencing right now. But this is kaya nga novel ang tawag dito coronavirus, no, because the first time that this affected the whole human race. no? Buong mundo ay hindi pa nakaranas nitong klaseng COVID-19 ang ating tawag, no? So it is a disaster that not only affected the Philippines but actually the whole world. And how are we coping to address this pandemic crisis, and how do we compare on how the other countries are coping with it, no? So yan siguro ang makukunan natin ng tinatawag natin na mga lessons learned, no? So if you will remember, our government started a lockdown on March 15 of this year, no? And the lockdown was supposed to be for only 1 month, pero naging 2 months, nagkaroon ng konting extension ng 15 days, bago tayo, on June 1, bago tayo nagpunta sa isang modified general community quarantine, no? So, yun ang parang naging takbo ng ating how the government addressed this problem. And of course, sa lahat ng pandemic, no, mayroon tayong tinayo way back, I think, on 2000, time ni former President Pinoy Aquino, nung binisitahan tayo ng SARS, nagkaroon tayo ng Interagency Task Force for infectious diseases, no? At ito ngayon ang organisasyon, ang task force na sa ating batas and sa ating bansa ang umiiral sa coordinate ng lahat ng agencies ng gobyerno para tututok sa paggawa ng mabilis na solusyon sa pandemic crisis na ito, no? So anong naging kwan dito? First, it is a novel. First time, no? Wala tayong experience. Yung na-experience natin sa SARS, sa MERS, at yung mga na-experience sa ibang bansa, sa Ebola, at of course, kahit na yung Spanish flu, way back the First World War, ay hindi natin magagamit dito sa bagong pandemic crisis na ito, na kasi ibang-iba talaga, walang vaccine. Ang ginawa natin, of course, is kung habang walang vaccine or cure, ay yung ating tinatawag na basic health actions, no, to fight a pandemic, which is, of course, social distancing, and wearing of masks and washing of hands, no? So more or less yan ang ginagawa natin lahat. So yung nag-umpisa tayo nung March 15, talagang totally lockdown yung whole of Luzon, no? Especially Metro Manila. At kung kayo ay mga frontliners noon during the first week of that lockdown, from March 15 to the end of March, makadaan kayo ng EDSA na halos walang traffic, no? Dahil stricto ang pag-implement ng lockdown noon. So, ang nagawa ng ating Interagency Task Force para masagot itong problemang ito, habang wala pang vaccine o cure, ay tinatawag natin na tatlong T's, no? Yung test, trace, and treat in isolation. So kung mag-test ka muna sa mga tao, and if they are positive, i-trace mo yung mga tao na nalapitan nila for the past 14 days, and yung mga positive na ito ay, of course, i-isolate mo para hindi sila makahawa sa ibang mga tao, no? So yan ang umiiral ngayon. But when niluwagan natin, no? Kasi talagang very effective noong total lockdown, halos talagang nag-flatten yung curve. Yung new cases ay hindi lumalampas ng 100. So parang niluwagan natin noong June 1, no? Pero nung nangyari yon ay talagang yung curve ay tumaas, no? Na sa ngayon, we are experiencing more than 1,000 new cases a day. No? That is, sa month ng May, June, ay hindi halos lumalampas ng 100. Ngayon, lumalampas na nga sa 2,000 cases a day. No? And sa ngayong araw na ito, I mean, sa ating sa ating Viber groups ay nakatutok doon yung pag-monitor ng mga number of new cases. At kung tignan nyo ito ngayong araw na ito, for the first time nalampasan natin ang 3,000 new cases, no? So, parami ng parami. In fact, ang ating total COVID cases ngayon, more than 83,000 na yun, mga 84 na nga, is even now higher than the present total cases sa China, no? Na kung saan itong COVID-19 ay nag-umpisa. So nalampasan na natin ang China and we are in fact number 1 now in the whole of Southeast Asia with the number of present COVID cases, no? So saan tayo mukhang nagkukulang sa no? Hindi ito katulad ng mga natural disaster na tayo'y handang-handa na every year. Halos may natural disaster na nangyayari, no? In fact, yung pinakamalakas na nangyari sa atin ay yung Yolanda, recent memory. Ang namatay doon is about almost 10,000. Pero yung kanyang effect sa ating economy, no, ay hindi kasing lawak ng nangyari nitong 5 months na nagkaroon tayo nitong COVID starting May 15. At marami nga namatay sa Yolanda. Sa ngayon, wala pa nga mga 2,000 pa lang ang namatay dito. Pero sa Yolanda, wala pa nga 2 months naka-recover na tayo. No? Ngayon, hindi natin alam kung saan tayo o kailan tayo maka-recover. No? Palala ng palala ang number of cases na nararasan natin na we are experiencing. At to the point now na pati yung ating mga health facilities ay na-overwhelm. No? And once that happens, na wala ng hospital beds na puntahan ng mga COVID patients. And in fact, kahit hindi lang COVID patients, no, marami ring namamatay na yung sa ibang sakit na hindi na aalagaan because napupuno na yung ating mga hospital. So ito yung mga nararanasan nating mga problema ngayon. Ang nakakuha natin, more or less nung ako'y pa nasa DICT, dalawang bagay ang ina-advocate ko, no? Dalawang bagay ang talagang tinututukan ko na dapat yung ating interagency task force ay magkaroon to focus on these factors nito. And these are yung ating data, no? Yung COVID-19 data. Importante ito dahil sa mga data na ito, if you have accurate and timely data, mas mahusay ang pagbigay ng mga desisyon ang ating gobyerno. No? Kung hindi maganda yung data natin, ay parang confused tayo. So, yun ang aking isang in-advocate. And then, of course, yung contact tracing. Dahil sa tatlong test, trace, and treat, no? Doon tayo pinakamahina sa contact tracing. Dahil ang contact tracing natin ay yung ginawa pa natin on time ng SARS o yung MERS na manual, no? So kung mayroong isang positive, tatanungin natin siya kung sinong mga nakalapit niya na pwede niya mahawaan, no? So, and then pupunta tayo doon sa sinabing tao, and again, ask the same question, no? So, walang problema yan noon dahil hindi ganito kalawak yung naging spread ng infection, no? Pero ngayon ay halos hindi tayo very very slow yung ating contact tracing, no? And para lang natin talaga, ito yung ginawa sa ibang bansa, no? They were able to flatten the pandemic curve, no? Dahil sa contact tracing. In other words, mas mabilis nila natitrace yung mga tao na pwedeng ma-infect, mas mabilis kaysa sa pag-spread mismo ng virus, no? So, ang ginamit nila is technology. Well, and then of course, itong technology na ito is of course available, no? Nag-successful sa Singapore, sa South Korea, sa Japan. Pero noong April 22, ang Interagency Task Force natin ay nag-decide ng isang digital application for contact tracing, no? Ito nga ang Stay Safe. At ito ay pinuna ko noon. Sabi ko, bakit hindi natin sundin yung mga successful na? Bakit pa tayo kailangan mag-invent ng wheel kung talagang nandiyan ay Singapore, no? In fact, during that time, bino-volunteer na ng Singapore na ibigay sa atin yung source code ng ginawa nila, no? Yung trace together sa Singapore. It was effective, no? And things ang sinabi ko kasi noon, una, yung contact tracing natin na itong Stay Safe ay mukhang may problema dahil hinihingi yung cellphone number mo at yung location mo, no? Alam natin na iba yung dating sa mga Pilipino kung hingiin yung, kahit hindi hingin pangalan mo, kahit hindi alam yung mga other personal circumstances mo, yun lang, cellphone number at yung kung saan yung cellphone na yan, ay may konti ng resistance, no? Dahil alam ko yan, when I was NTC Commissioner, actually, isa yan sa mga serbisyo na provided by Artelco, kung matanda nyo, Globe and Smart, panoon yun. At nagbigay sila ng serbisyo sa sa kanilang subscribers, no? And I approved it. Na pwede silang Find Me, no? Yung Find Me apps, kung matanda nyo yan, na kung gusto mong i-locate yung iyong anak, for example, or yung sa isang kumpanya, yung mga inyong empleyado, or yung isang delivery van ng kumpanya mo kung saan na, ay pwede mo magamit yung apps na yun, no? And then, of course, ita-triangulate yan ng cell sites ng Globe or ng Smart. At approximately, makukuha mo yung location to the nearest 25 meters, no? Radius. Hindi gaano nag-click yon dahil nga yung ayaw ng kahit ng mga anak natin, ayaw nila yung parang malaman kung saan sila pumupunta, no? So, remember, when I was NTC Commissioner, 2001 to 2003, ang mga cellphones natin doon ay 2G, no? Yung GSM network natin ay still 2G. Dalawa lang serbisyong binibigay noon, talk and text, no? Yung voice and SMS. Yun lang ang serbisyo binibigay ng 2G. Pero yung dumating yung 3G ay nagkaroon ng access to the internet at dito na ngayon, ang mga cellphone natin ay nagkaroon na ng mga GPS, Bluetooth, at iba-iba ng apps ang nangyari, no? So, mayroon na tayo ngayong Waze, no? Na pinapayagan mo yung application ng Waze na pwede kang ilocate para masabi sa iyo kung nasaan ka na sa daan and kung saan o paano pupunta doon sa gusto mong destinasyon, no? So these are the same application, no, na ginagamit sa contact tracing. And of course, yun nga, magkakaroon ng konting resistance sa upload ng apps na yun, no? Plus the fact na itong apps ay para lang sa mga smartphones, no? Karamihan pa rin ng Pilipino, about 20 million of us, ay yung telepono nila are 2G. And of course, yung ating coverage, no, ay hindi lahat maka-access ng internet kasi kailangan mo talaga ng internet kahit for example nasa Waze ka, kailangan may internet connectivity ka, kung hindi yung apps ay hindi gagalaw o hindi gagana, no? So yun ang mga challenges na sinabi ko. So sabi ko, kailangan hindi lang sa isang teknolohiya o sa isang apps lang tayo depende. Kailangan isang spectrum. Dahil may 2G tayo, hindi lahat ng area ng Pilipinas ay may internet, mobile internet connectivity. So hindi mo makuha ang contact tracing yan. Pero yung pwedeng magamit, yung ginamit natin noong 2001 to 2003, doon sa paggamit ng mga triangulation ng mga cell sites, no? Kahit anong cellphone mo, kahit walang apps na nakalagay sa cellphone mo, basta mabigay mo lang yung number sa telco, pwede nilang i-locate within 25 meters kung saan ka. So sabi ko, dapat kasama yan sa ating contact tracing, no? Because yan ang pinakaunang pwede kasi for a contact tracing apps to be effective, you need to have 60% of the population download it. Yung mga cellphones nila, mayroong naka-download na apps na yan, 60%. In other words, parang mga 65 million yan na sigurado ka pag ikaw lumapit o nalapitan ng isang tao ay may 50% chance or 60-40 chance na yan ay mayroon ding apps, no? Kasi kung ang taong nalapitan mo ay walang apps na katulad ng iyo, useless yung apps na yan. Pero itong paggamit ng tinatawag natin ng call CDR, no, call detail records, ay hindi mo kailangan ng anong apps. Bigay mo lang yung cellphone number at ibigay mo sa telco na itong owner nitong cellphone na ito ay pumapayag na i-track mo yung kanyang location for the past 14 days, no? Kasi sa manual interview, of course, tatanungin mo yung na-test na ng positive kung sino yung mga na-contact niya, no? Siyempre, he will depend on his memory, ay hindi niya malalas kung sinong mga nalapitan niya except yung mga member siguro ng pamilya niya, no? At mga kaibigan niya. Pero kung makuha natin yung CDR records niya, ay at least makikita natin na ay pala pumunta ka pala sa kabilang barangay sa lugar sa ito, no? So yun ang isang dapat maisama sa isang magandang contact tracing. No? But unfortunately, hindi ako ang nasunod at in fact, siguro dahil sa aking insistence na uh, na hindi na maglagay ng other apps other than stay safe, no? I think that caused my being eased out from the government, no? Isa pa yung ina-advocate ko noon ay magkaroon tayo ng maganda, honest to goodness, timely and accurate data, no? Maganda pa nga yung data natin, magawa natin ng analytics, no? Visualization. Kasi mas madaling maintindihan yon kung ma-visualize mo yung pag-move ng mga data natin, no? Tumataas ba, bumababa, marami kang makukuhang pandyan, no? So parang ang pinopropose ko noon, and in fact, mayroon na nga ang DICT ng tinatawag natin na data lake, no? Na dito natin idadump lahat ng data manggagaling sa LGUs, manggagaling sa DOAs and other government agencies at sa mga apps, no? Whatever apps are available, dito natin i-dump at magkakaroon tayo ng data warehouse na mayroong artificial intelligence na mag-visualize, no? Na itong parang isasala muna yung mga data na dumarating. Ito, pareho lang itong data na ito because the same date, the same location, and so on and so forth. Yan, magagawa yan, mabilis ng data, ng artificial intelligence. No? Isang software yan na mayroon na rin tayo sa DICT na magagamit. No? And open ang access. In other words, pag-authorize ka yung mga ating researchers, for example, sa UP or sa wherever, no, na gustong mag-analyze ng data na nasa kwa natin, i-open natin yan sa mga eksperto, no, na para sila maka-analyze talaga at makakuha ng very accurate and timely data, no, dito will be the basis kung paano makapagbigay ng magandang decision sa ating course of action. No? Alam natin yan sa military na intelligence o yung data gathering is very important for this. Again, I was not, hindi rin pinakinggan yung akin. No? Wala ngang additional cost sa gobyerno yun eh. Pero they came up with a closed system on giving out data. At yun nga, ito ngayon ang nakakuan. Hindi natin nalaman kung ang data for today is accurate. Kung matandaan nyo nung sinabi ng UP na because of the reproduction rate sa end ng June ba yun? Magiging 40,000. Tuwang-tuwa si Secretary Harry Roque na naging 38 lang noong nanalo na raw, no? Pero pagdating ng July 1 at 2, dito na pala dumagsa yung mga late, no? Na hindi pa na-report. Kung yun ay na-report noong end of the month, ay talagang more than 40,000 pa. But anyway, these are things, no, na nag-i-indicate ano bang ating hindi ginagawa ng tama because bakit ganito kataas ang pagdagsa ng mga positive COVID cases, no? So yun, ang isa pang difference sa itong pandemic na ito at sa ating mga natural disaster is tayo, ang RETT, at tayo mga advocate dito sa disaster risk reduction management ay yung communication, no, para sa mga responders, para sa paghanap ng mga survivors at lahat, no? Dahil after a disaster talagang down na down ang mga ating commercial telecommunication, no? Sa ngayon hindi nangyari yan. Walang down. Ang naging problema natin ay noong nag-lockdown tayo, halos lahat ng Pilipino sa Metro Manila, sa Luzon, and in other parts of the country, nagtutok sa internet. No? So kaya hindi naging very slow yung ating connectivity. No? At ang ko nga, no? Kasi nung 2016, yung bago pa yung DICT, ito kagad ang tinutukan namin, no? Yung paano ma-improve ang ating telecommunication services dahil ito yung isang campaign promise ni Presidente, no? So, yun nga, nag-telco tayo, nagkaroon tayo ng common towers para dumami yung towers natin. Nagkaroon tayo, at dito sa pagpanang kay telco, dito rin napilitan ang Globe and Smart na improve yung kanilang network, no? In fact, since 2018, yung nakaselect tayo ng isang telco, 2018, 2019, at ngayong year, Globe and Smart put in their biggest capital investment, no? Pinakamalaki sa buong 24 years nila in existence. Ngayon talaga sila, because they were anticipating a competition from dito, no? Kasi ang ginawa natin, yung dito, binigyan natin sila ng tinatawag natin ng ang selection process natin doon ay yung X-close tawag natin, o highest committed level of service. Yun ang kuha natin na, sige, pataasan kayo ng inyong i-commit na level of service at ito ay yung speed ng inyong internet, yung inyong coverage, at kung magkaano yung inyong i-invest, no? So and hindi lang yun, for the first time, sinabi natin, sige, kung sa commitment nyo, para talagang committed kayo, maglagay kayo ng performance band. Hindi natin ginawa yun sa Globe and Smart, no? So ang nanalo, talaga naglagay ng performance band na kung hindi niya ma-attain yung kanyang committed level of service, yan, mababawi ng gobyerno yan, no? So talagang because of that, gumanda ang ating noong 2016, mga 12 megabits per second lang yung ating speed noon. Nung itong end ng 2019, beginning ng 2020, ay umabot na ng 22 megabits at ngayon naglalaro sa 24-25 megabits, no? Kung itong pandemic na ito yung nangyari noong 2 years, 3 years ago, talagang babagsak yung ating telecommunication infrastructure dahil hindi tayo prepared na magkaroon ng so much demand sa pag-connect sa internet, no? At isa pa yung nakatulong is kung matandaan nyo, isa sa mga unang hinihingi ni Presidente ay yung paano malutas yung traffic sa EDSA, no? So humingi siya noon ng emergency powers. Ang DICT noon ay nagsabi, well, itong traffic sa EDSA ay pwedeng malutas not only by putting up more roads, mga highways, skyways, pero pwede natin ito lutasan sa pamagitan ng ICT solution, no? Ang dalawang cause ng traffic sa Metro Manila ay yung mga taong pumupunta sa trabaho at mga estudyanteng pumupunta sa kanilang eskwela, no? Kung ito ay makapag-aral sa bahay nila o makapagtrabaho sa bahay nila, then it will solve the traffic in EDSA, no? That was way back 2017 nung sinasabi namin yun. And because of that, nagkaroon tayo ng itong telecommuting law, no? At ito ang nakatulong sa pandemic na ito. Dahil dito naglatag ang mga telcos na mga mabilis, no, na internet sa mga bahay because nagkaroon ng demand for it. Pero kulang pa rin, of course, kulang pa rin. Kaya nga sa zona ni Presidente, anong Lunes ay sinabi niya kailangan pa rin mag-improve ang mga telcos or else ay talagang papasok ang gobyerno sa inyo. No? So, yun ang isang ginagawa ngayon ng DICT, no? Para paano mabigyan ng standard na hindi ma-attain ng mga telcos itong standard, no? Kailangan realistic by December. Doon iiral yung sinasabi ni Presidente na papasok ang gobyerno, no? And what are these standards? Well, measurable. They should be measurable. At ito, mayroon na tayong experience dito sa pagpili natin ng telco, no? So ano ito mga measurable? Ilang cell site ang magawa ninyo hanggang Disyembre. No? Kung ang gobyerno naman ay papaluwagan ang pagbigay ng permit sa inyo kasi isang problema na bakit ang cell site natin ay ganito lang kaliit is because of red tape ng binibigay ng mga local governments. No? We have a backlog of 50,000 cell sites. No? Ang cell sites natin ngayon is only around 20,000. At i-compare mo ito sa Vietnam. No? Halos the same ang population natin, 28 million sila, tayo 105 million. Ang cell size natin is only 20,000. No? Sa kanila, 70,000. So just to compare with Vietnam, we need another 50,000. And ang average ng Globe and Smart to put up their cell site, since they started 24 years ago, ay hindi lumalampas ng mga 1,000 each. No? 1,000 sa Globe, 1,000 sa Smart, or 2,000 average a year. No? Eh kung 50,000 yan, 25 years pang hihintayin natin. No? So hindi tayo, kaya nga nagkaroon tayo ng common towers para mas mabilis ang paglatag. No? So ito yung dapat masuri natin kaagad. Well, I think mayroon naman tayo sigurong question and answer period. No? So doon ko na lang siguro sagutin yung hindi ko na-touch sa aking presentation ngayon. Maraming salamat po.
Hello. Maraming salamat, Undersecretary Eliseo Rio, ang aking ama.
Kamusta ka, anak?
I'm sorry, sir. I just came late because of some work here until now.
Ay talagang ganyan si Ed.
Yes, sir. Mga takeaways natin, ladies and gentlemen, kay Honorable Undersecretary Rio, ang sabi niya kanina sa pandemic, it should be all-inclusive. Ang sinasabi natin, communication is always aid. In the new normal, therefore, yung telcos, connectivity, ang pagkabanggit ni Sir kanina, were rendered to be crawling. In fact, sir, kaya ako na late yun din yung isa sa mga dahilan. Gusto ko na sana magmura, sir, kaya lang hindi pwede. So, and then, ang na-capture ko, sir, later marami po akong tanong sa inyo, sir, kung may time pa.
Okay.
Especially yung stay safe, na hindi sila pumasa sa Google Apple exposure notification technology because of the 3 strict condition of Google. So later, sir, be ready to answer question queries from our participants and audiences. Sir, for the meantime, maraming salamat, sir. We will introduce the next speaker.
Thank you.
After you, sir, dito. Thank you very much, sir. Please stay muna, sir.
Standing by. Yes.
Thank you, sir. Roger on that, sir. Okay, so I hope you also have some takeaways from Yusek Rio, one of the patriots ng Pilipinas. He has been with us fighting for our rights and what is proper, what is moral. Yan lagi pinaglalaban niya lagi. Okay, so Our next speaker, she will be uh, giving us a lecture on the emergency response strategic perspective. I will introduce her based from my personal experiences and working relationship sa ating next speaker. My introduction is basically based more on personal note. The next speaker is a was an ASEC before Assistant Secretary sa DSWD until such time na naging because of her passion sa trabaho, she was promoted to Undersecretary. I was with the next speaker from 2013 to 2017, kung di ako nagkakamali, yeah, sa National Disaster Risk Reduction Management Council. During our time, we published 3 books, kasama siya. We are together in our team sa Zamboanga Crisis, Bohol Earthquake, Super Typhoon Yolanda, Super Typhoon Lawin, APEC, Miss Universe Pageant, and ASEAN, High Population Density Gathering. And after her stint in the SWD, she was then connected to the World Food Program. And ladies and gentlemen, excited na rin ako na mapakinggan ang ating next speaker. A mother, a good sister to some of us, a colleague, and also a patriot. Ladies and gentlemen, our next speaker is Undersecretary Cheche kasi ang gusto niyang patawag kay Ma'am eh. Cheche Cabrera. Ma'am, good evening po. Take it away.
Good evening. Good evening.
How are you po,
Colonel.
Ma'am?
Yeah, I'm good. And first of all, I would like to thank the organizers. Maraming salamat po at hindi ninyo ako nakalimutan at
Ma'am.
sa aking mga kasamahan as resource persons. Ito po yung mga dati ko ng kasamahan na magagaling, very dedicated, very patriotic, and most of all, they're so dedicated in their work with the RRM. Okay, so personally, I do not have experiences working directly with IATF, but the sharing that I will be doing relates very much to some of the activities of the IATF, maybe, in the sense that the response pillar of the National Disaster Risk Reduction and Management Council, most of the officials at INDRIMC are also officials of the IATF. Okay? So the program that the COVID-19 had caused, meaning the social amelioration program and even the health response services are also part of the response pillar of the regular INDRIM functions. Okay, so let me start with my presentation.
Go ahead, ma'am.
Can my presentation be shared on the screen? Here. Okay, so I'll be presenting the disaster management response agenda of the government, particularly picking up from the years when I'm still with the Department of Social Welfare and Development, when I'm still leading the technical team of the INDRIM for the National Disaster Response. And there are several milestones while I'm still with the INDRIM functions for National Disaster Response that may trigger discussions later on for the COVID-19 response systems. Next slide. Okay. Now, during the 5-year period from 2015 to 2019, you'll note that a total of 26.3 million had been adversely affected by several disasters. So these are the persons, the individuals, the counting of the individuals who were exposed to and directly affected by different types of disasters. So you'll note the Philippines is the third most disaster prone based on the World Disaster Index in 2018. And because of that, the category of the Philippines, even if we have made several advancements in terms of technology and economy, all these are being pushed back because of the occurrence of disasters. So you'll see on the screen the most number of victims of disasters, particularly for tropical cyclone, are in 2019 and in 2015. Okay, so you'll note that the types of disasters, almost all types, had happened or had affected the Philippines. So if we have to compare 7-Eleven and a mega mall, then the Philippines have all the types of disasters which might make it a mega mall. Next slide. Okay, so this is the framework of the National Disaster Risk Reduction and Management Program in the country. The main objective is to have a safer, adaptive, and resilient population and communities towards a sustainable development. Okay? As I mentioned earlier, several advancements had happened, but because of disasters, were pulled back to situation that still renders our population vulnerable to types of disasters. That's why in 2010, the Philippine Congress passed the National Disaster Risk Reduction and Management Act, which provides for a system, a framework of institutionalizing the DRRM in all of the local government units and in the national level of governance, so that people will be assisted whenever disaster occurs, and they can rise back. They can be at their normal lives immediately. So you'll note in the framework that in the past, the four pillars or the four subdivisions of disaster risk reduction and management are almost of the same size. You'll note then that the response of the Philippine government is, also a big concern even when the law had been passed. So the recent law, the RA 10121, had provided for major change in the systems of addressing disaster risk reduction by expanding the focus for prevention and mitigation. Unlike the past years, that prevention and mitigation had received the same focus as the others. So you'll note that under RA 10121, prevention and mitigation, if properly executed, if properly delivered, would reduce the cost for preparedness, would reduce the cost of responding to affected population, and even rebuilding and recovering from types of disasters. Next slide. Okay. So itong slide na ito ay hiniram ko sa DSWD. Nakikita natin na yung apat na pillars ng National Disaster Risk Reduction and Management Program ay pinakita na meron tayong apat na pillars. Okay? Yung pinakamalaki at dapat bigyan ng pansin ay yung prevention and mitigation. Ito yung nagsasagawa ng mga programa, interventions, and mechanisms para hindi mangyari ang sakuna, or kung mangyari man, mas lesser ang kanyang adverse effects. Number 2 is the preparedness cluster, or the pillar by which all the local government units and the national government agencies will be doing its work in preparing for eventualities of occurrence of disasters. It is said that the quality of response and recovery depends largely on the type, the extent, and the quality of the preparedness measures that one had undertaken. And that's very true for the response, which is led by DSWD, kung ano yung naitulong ng preparedness cluster, yung mga gawain kung nagawa under the preparedness, ang DSWD ay kukunti na lang ang kanilang magiging concerns, at yung cost of providing humanitarian and relief assistance would be minimal. Okay? So yung last pillar is the recovery and rehabilitation. And this is led by NEDA, simply because rehabilitation and recovery should not be outside of the National Development Plan, should not be outside of the priorities of government. So kaya nagkaroon ng leadership ang NEDA for rehabilitation and recovery for that matter. Next slide. Okay. So ito yung current na disaster response pillar, one of the 4 pillars of the National Disaster Risk Reduction. Now, you'll note, may tatlong kulay red. Ito yung led the clusters or the humanitarian clusters which DSWD had led. Okay, so first is that of food and non-food. Second is camp coordination and camp management. Then IDP protection. Now, itong tatlong ito, together with the 9 others, ay gumagawa ng paraan to provide life-preserving and mechanisms that will be able to assist the population adversely affected to go back to normalcy. Okay, so makita natin yung different clusters, kung titingnan nyo, ay merong relasyon sa COVID-19 response operations. Like for example, for the Department of Health, sila yung cluster lead ng health cluster, DepEd for education, which is still also very active, responding to requirements of school children or students in high schools that need access to quality education. Meron din tayong CCCM, ito yung sa DSWD. Meron tayong emergency telecoms. Dito, my past experience is very important. No? The ETC in my past experience is very important. You know why? Ang emergency telecoms, dito nagmula yung ating rapid emergency telecoms team na nagiging isang private entity na ngayon na in the event na may emergency, the emergency telecom, sila yung naghahanap ng paraan para at least makakuha kaagad ng data from the affected areas. My experience with Typhoon Yolanda, Typhoon Lawin, in Zamboanga, armed conflict, the Bohol earthquake, talagang napaka-importante ng emergency telecoms in providing timely and accurate data for decision makers. Paano tutulong, iilan ang tutulungan, at kung kailan tutulong. The data that we received from the field were very important. Then the law and order, nowadays in our COVID-19 response operations, nakikita natin mga police, mga military ay sumasama sa mga civilian authorities to enforce law and ensure and orderly operations at different levels of government. So barangay, city, municipality, meron tayong mga kasamahang mga pulis na sumasama sa mga elected officials na may importanteng gawain sa barangays. Sorry. Sorry. Meron din tayong bagong na-develop na sorry, humanitarian assistance cluster. Ito yung led by the Department of Foreign Affairs, the International Humanitarian Assistance Cluster. Kung titingnan natin, ito ay dapat i-operate din ngayon because of the different support, the assistance, funding, material, and even technical support provided by other countries. So, kung andyan yung International Humanitarian Assistance Cluster, mamomonitor nila at makapag-recommend sila kung saan dapat dalahin whatever assistance received from foreign countries. Next slide. Okay. So ito yung first cluster at the humanitarian assistance clusters ng mga NDRRMC that's led by the DSWD. That of the food and non-food items cluster, which primarily respond to food and non-food requirements of the affected population so that their lives may be saved, or the food insecurities in their areas will be minimized or will be prevented. Okay, so dito marami tayong mga kasamahan who helped DSWD in the past and even now in terms of providing food and non-food items to disaster victims. So makikita natin, it's not only government agencies, but there are lots of NGOs, corporations, which assisted DSWD in responding to requirements of individuals, families, and households for specific food items. Next slide. Okay. The camp coordination and camp management provides assistance and augment whatever requirements the local government units has in order to respond to the requirements of the families and the individuals displaced from their residencies and are residing temporarily at evacuation centers. At the same time, the cluster delivers the essential services to victims inside evacuation centers or even outside, those residing with their friends or their relatives to ensure that their well-being is assured, their protection from abuses or whatever criminalities are prevented. So CCCM, in coordination with the next cluster, the protection cluster, ensures that nothing bad or any untoward incident are prevented from occurring or from affecting the disaster-affected families and individuals. So makita natin dito, the CCCM, marami ring mga other agencies in government, sort of whole of government approach ito, para at least matulungan kaagad yung mga pangangailangan nung walang bahay, walang mga gamit, at walang mga medisina in terms of at the height of disasters. Next slide. Okay, so this is the IDP protection cluster, and this is very much concerned with protection of individuals and families preventing protection issues from occurring, and that whatever concerns in terms of human rights, in terms of physical violation or abuses are prevented or mitigated immediately. So the IDP Protection Cluster works in tandem with civil society, with the DRLG, the Department of Justice, Philippine National Police, and the Armed Forces of the Philippines in order to provide and act immediately on whatever response requirements in terms of personal protection and human rights protection that the victims require in wherever they are. Next slide. Okay, so DRRM response programs, hindi lamang DSWD ang gumagawa nito, but mainly led by DSWD. And here, I would like to emphasize that the response programs does not only concern with the response proper, but it also looks into preparing and even looking into the concerns after the disaster response proper that the victims require. Okay, so next slide. Okay, so number one is that of preparedness for response. Ano yung mga ginagawa to prepare for responding to any eventuality or to any disasters that may occur? Yung pinakauna is that of planning, policy review of existing programs, and developing new programs that are needed by the disaster victims in the past disaster. So, hindi stagnated dapat. The policy review focuses on the effectiveness, how responsive the programs of DSWD and other agencies in terms of responding to the requirements of the affected population. Second is that of pre-positioning of standby funds and relief resources at areas, at field offices of the DSWD in order that they are ready anytime when they are needed. So standby funds at the height of disasters, the regional field offices need not wait for the national DSWD to release funds because they have standby funds, amount of which are determined historically. Iilan ba yung mga disasters na nag-o-occur sa locality nila, or the historic number of individuals and families affected by past disasters. So yun yung basihan ng pag-compute ng standby funds. Now, relief resources need not be food alone. No? So pwede silang mag-standby ng over-the-counter na mga medicines, gamot para sa lagnat na hindi na kailangan ng resita, mga kumot, mga kaldero, or even the hygiene kits. So dapat i-preposition na ito at various level. In the past, DSWD even provides support to local government units in terms of providing relief goods that can be stockpiled at their warehouses. Number three is that of recruitment, training, and managing volunteers who are deployed during massive disaster operations. So dito, hindi lang yung repacking ng family food packages or repacking ng food and non-food items, but also in terms of providing psychosocial support, in terms of providing guidance and counseling to victims of disaster. So, kailangang ma-screen yung mga volunteers at ma-train sila on what they should do in the event that they're deployed to affected areas. Next slide. Okay, number four is that of providing capacity building to local government units on camp coordination, camp management, IDP protection, psychosocial processing, family and community disaster preparedness, and information management. So ito yung mga areas that are very, very much crucial whenever a disaster occurs. Kaya dapat merong training beforehand to the workers of both DSWD and the local government units and even partner NGOs. Now, number 5, the institutional partnerships happened not only during response, but even in the consultation process, in the review and development of policies related to disaster response. Ini-invite yung mga registered and licensed NGOs of DSWD to consultation meetings and workshops to improve policies and to enhance operational systems of the department in providing response assistance to different areas and population affected. Next slide. Okay. So ito na yung disaster response na mga activities. First, whenever for hydromet, no, if the typhoon or the tropical cyclone enters the Philippine area of responsibility, and there's the conduct of the PEDRA, we used to conduct PEDRA, PDRA, the in-DREAMC response cluster is activated immediately. Pag once sinabi na yung typhoon had entered already the Philippine area of responsibility and the projection is not good in terms of population, areas and population that's possible to be hit, in-DREAMC response cluster is meeting immediately and then move on to activating and calling all members to represent the response cluster in the operations at the in-DREAMC OPSIN. Number 2 is that of mobilization of quick response teams. Hindi lang po ito DSWD, I remember very well. Typhoon Lawin, when it occurs hitting Cagayan and then Batanes, the riders and the ETC team, the RETT teams, had moved in advance to the areas that's potentially to be affected by Typhoon Lawin, and that the first day the typhoon did a landfall and hit the ground, the reports were immediately received by the National Disaster Response Cluster from the Rapid Emergency Telecoms team deployed on the ground. So may mga riders, they use personally their bikes in order to reach potential areas that will be affected and be able to participate in the preemptive evacuation or even provision or distribution of relief assistance when they are on the ground. Number 3 is that of providing relief augmentation. What do we mean by relief augmentation? Ito yung DSWD kasi are providing standby funds and standby relief goods at their regional offices. So whenever the local government unit is affected, the regional office can provide immediately augmentation support to the local government units, particularly those whose local calamity funds had already been disbursed or had already been utilized in past disasters. So relief augmentation will come from the DSWD in the kind of food, non-food, and even sometimes cash support. Next slide. Okay. Now, the disaster response is the main responsibility of the local government units. So, ang ibig sabihin, kahit at the national level, DSWD ang chair ng National Disaster Response. At the local level, it's the local chief executives and they are responsible for their constituents on the ground. So the DSWD provides technical assistance and resource augmentation to affected LGUs, and even before the strike of a typhoon or a disaster, technical assistance are provided or is provided by DSWD, particularly to frontliners of the local government units and the intermediaries or partners that are involved in camp coordination, camp management, IDP protection, psychosocial support, and the family and community-based disaster preparedness, and information management, particularly led by RETT, and at the in-RIMC level, the ETC or the emergency telecoms. At the DSWD side, DROMIC or the Disaster Response Operations Management Information Center of DSWD links up with ETC to gather feedback, to gather report from the affected areas. Next slide. Okay. Now, early recovery and rehabilitation sometimes is also provided by DSWD in terms of families or communities that do not have resources. Particularly yung sirang-sira ang bahay, sirang-sira ang sources of income, at wala silang ibang mapagkunan ng support for immediate recovery. So, tinutulungan sila through cash for work, which is equivalent of 75% of the current regional wage rate. In the usual implementation of the cash for work, the maximum timeline is 30 days. Now, the number of days provided to the cash for work had been evaluated, and there might be changes in the immediate term because of the need of the affected population to recover immediately. Next slide. Okay, so limited financial and material assistance for repair of damaged houses, particularly yung hindi naman sirang-sira ang bahay, yung may mga minor parts lang needing repair, ay DSWD provides assistance to that. Also, in terms of providing support to families with totally damaged shelter units, the current maximum rate is 30,000, and that's for families with totally damaged houses, and 10,000 for families with partially destroyed houses. So, nagkakaiba yung rate of assistance that DSWD provides to families with partially damaged units from that of totally or families with totally damaged shelter units. Next, please. Okay. Milestones in DREAMS's response pillar. Ito yung mga mahalaga, mga importante, mga memorable events that happen or events that occurred at the response pillar of the NDRIMC. Next slide. Okay. Number one, ito yung formulation of the 3 national disaster response plans. I would like to acknowledge Colonel Ed Sadang for the valuable assistance. Siya yung aming team leader for the development of a disaster response intended for hydrometeorological hazards and disasters. Medyo 2014, immediately after Typhoon Haiyan, pinag-isipan na ito na gawin to guide response operations in the country after the massive destruction that Typhoon Yolanda or Typhoon Haiyan had caused. The second one is that of national disaster response for earthquakes and tsunamis. So, hindi lamang bagyo, hindi lamang pagbaha, or hindi lamang yung mga landslides ang tinitingnan in terms of designing a proper response, but also seismic movements, earthquakes, and tsunamis, even volcanic eruptions ay kasama dito. The third one, ito yung pinaka-late na na-develop, that of consequence management response plan for armed conflict. Napaka-mahalaga nito, particularly in areas na medyo every now and then, merong nangyayaring hindi maganda, merong mga nangyayari that, displaced several families and require them to stay outside of their original residences for several months. So the National Disaster Response Plan for that was designed or was thought of immediately after the consequence that, Zamboanga, the failed siege of Zamboanga had caused. Maraming mga sirang bahay, maraming nasunog na bahay, maraming mga pamilyang nawala ng hanap buhay, at they have to stay at the grandstand in Zamboanga City for several months. Next slide. Number 2 is that of the use of predictive analytics. And I would like to acknowledge here the support of former ASIC Ninoy Castro and his team, sila Kim. The predictive analytics, ito yung approach or the strategy of looking forward. Pwedeng mag-move tayo sa next slide, of predicting future disaster events and to prepare the government on how much where to stockpile and who should be there, using mathematical formula, science-based and technology-based, using current and historical data. So yung predictive analytics, hindi ka dapat mag-antay lang kung ano yung disaster report. But beforehand, before the occurrence of a disaster, meron ka ng data na hawak na kung ito ang mangyari, potentially ganito kadami yung maapektuhang pamilya, mga apektuhang mga tao. So, rather than waiting for disaster reports to be submitted by the local government units or by disability field offices, nagkaroon na ng prediction where and how many will be affected by a particular disaster. Next slide. Okay, so yung maps, hazard maps, presenting or providing vulnerability of population to flooding and landslide from DENR MGB, the Mines and Geosciences Bureau, ay napaka-importante dito. And the historical data that INDRIMC has, particularly OCD, for areas that are habitually, historically affected by disaster. So makikita natin, if the area is susceptible to flooding and landslide, that particular area should have data as to the number of population and their vulnerabilities and susceptibility to flooding and landslide whenever heavy rains occur. Next slide. So take note, dun sa una, yung physical vulnerability, ang tinitingnan. In this second factor, the predictive analytics look into the population of the poor households residing or in that particular area. So, saan nakatira itong mga mahihirap? Kung sakali sila ay physically vulnerable to hazards such as landslides and flooding, and then very poor sila residing in a very in a house or shelter units that's constructed out of very light materials, mapipredict mo na kaagad iilan yung potential na magiging disaster victims for a particular landslide. So, ginagamit dito yung listing ng NHTO, the targeting system of DSWD, locating and giving face to the poor in the country. Next slide. Okay. Itong number 3, even before the passage of RA 10121, existing na ito. However, maraming kakulangan na nakikita. Like for example, wala kaming mga truck before, wala kaming mga equipment that can help fast track, facilitate, and even shorten the process of uploading, shorten the process of repacking, and shorten the process of sending relief items, relief goods to the population needing the commodity. So, INROC's or National Resource Operations Center of DSWD had been very supportive in terms of providing support to regional offices of the department during massive disasters or massive events. Now, nowadays in the COVID-19 operations, relief repacking, family packages for highly vulnerable areas are still being done, particularly preparing for events in these months. The months of July to October are very heavy for hydromet. So, kailangang mag-prepare ahead yung mga stockpiled commodities at the region and at the national level. Next slide. Okay. Now, this one, why this had been a milestone? Because in the past, I mentioned earlier, kailangang mag-antay ng linggo, ng buwan, bago magkaroon ng konkreto at komprehensibong reports ng disaster affectation sa isang area. So, nung nagkaroon ng RETT, nakatulong ito talaga in terms of gathering immediately feedback from the ground, disaster reports coming from local government executives, detailing the affectation and the requirements of their affected areas. Next slide. Okay. Now, last January, the DSWD had requested the approval of the National Disaster Risk Reduction and Management Council for the emergency cost transfer to become a national strategy for disaster response whenever disaster occurs. Now, an emergency cost assistance transfer is an adaptive strategy that liberates and enables persons or victims of disasters to decide what to buy, what services to buy, or what goods to buy that are responsive to their needs. The cash transfer had been designed for support to local government units whenever a state of calamity had been declared, or when markets are operational at the local level, and that of data supportive of the decision making to be done by the DSWD executives. So the factors that are required to activate emergency cash transfer, una yung declaration of a state of calamity, operational markets at LGU level, and comprehensive data that would enable decision makers to decide. Next slide. Okay. Ito ay another important milestones, particularly in taking care of children who are affected, displaced, or victims of, they're victimized by a disaster. So they're protected by the law, and DSWD was the one leading the implementation of this one in coordination with the Council for the Welfare of Children and other NGOs that are implementing children-related or programs that support or protects children. Next slide. Okay, these are the challenges that we have encountered. Una, yung disaster reporting and information management. Particularly in massive disasters, talagang napakabagal ng generation ng report from the field. Yung information ay inconsistent most often. Iba-iba yung sinubmit ng LGU at ng regional office ng DSWD. At kung antayin mo, talagang mahirapan kang magbigay kaagad ng tulong dahil nga very inconsistent yung mga data. Now, yung pangalawa, it seemed that the national standards ay hindi kaagad ina-adapt or hindi ini-implement ng mga local government units, yung mga partners on the ground. So, imbis yung standards for evacuation centers ay ganito, ang nangyayari, yung standard, yung evacuation center ay napakaliit, walang toilet, walang provision for wash, at laging may problema. No? So, hindi nasunod yung nationally issued standards for disaster response. Then, yung sustainability of TARA, most often, mga local government units ay hindi nila priority yung magpapatraining o manghingi ng support from DSWD to train on disaster response, disaster management, or even other interventions that would enhance their capacity to respond and to recover. Then the resource assistance, itong mga LGU sometimes, medyo kahit meron pa silang funding, ay nanghihingi kaagad from the national government, which easily depletes the budget of the national government. So sustainability is in question. Number 4 is also the same. Yung mga LGUs, sometimes hindi nila pina-prioritize paggamit yung kanilang local in-dream fund. They're dependent from support of the national government or even the NGOs and international organizations. Number 5, I'm sure this is also true with the other offices and with the other pillars in DRIMC, the limited human resources. Even in COVID nowadays, the frontliners, kawawa talaga, mga police, mga doctors, mga nurses, even the military, meron ng mga COVID positive and medyo nag-cause ng lalong pagbaba ng numbers ng mga frontliners responding to COVID-19 patients. Then number 6, transparency and accountability. This is very important in terms of ensuring that the funds intended for the people are delivered, are distributed properly to the people and make them provide for themselves out of the support that the government had provided. So ito ay in the SAP category, maraming mga senators ngayon na nag-request ng special audit by the Commission on Audit so that to establish whether or not the budget that had been appropriated for COVID-19 response were used as intended. Next slide. Okay. So, point to think about, no? Having went through the interim acts, the National Disaster Response Management Law, um, having heard about the National Disaster Response Framework, the structure and the mechanisms for responding to disasters, sa tingin nyo ba ito ay pwedeng i-adapt, pwedeng i-adjust so that the COVID-19 pandemic response systems can be supplemented by the regular in-dream response mechanisms? So ito po yung isang question na gusto kong i-raise, and I'm sure may feedback from our participants online kung ano ang nasa isip ninyo. Okay, so next slide. Okay, so to the other speakers, thank you. Kay Yusek Rio, salamat po. And for the other two resource persons for the sharing later. Last slide. Okay, so that was the last slide. Thank you very much, and I look forward to interacting with you during our open forum after the two other resource persons had delivered their messages and their presentation. Thank you.
Okay, maraming salamat po, Yusek Undersecretary Vilma Cheche Cabrera. Narinig po natin, we heard that she discussed more on the strategic level of disaster response. Later in the discussions, we'll try to relate. Kaya yung last slide ni Ma'am is ano ang magiging relationship nito sa COVID-19. Ang tanong is, pwede bang i-adapt? Pwede bang gamitin? Do we need to reinvent the wheel? So from the word of Yusek Rio kanina, and aside from that, diniscuss din ni Yusek Cabrera, ni Ma'am Che, yung response mechanism. There are members of the response cluster that is most probably and I believe applicable in what is happening in the COVID response management operations. Example is relate natin doon sa sinabi ni Yusek Rio kanina, yung importance of communication, analytics. There is that cluster which is the emergency telecom cluster, which is very important, sabi nga ni Ma'am kanina, due to the birth of RETT-PH, dito po nagsimula yan. So makikita niyo yung relationship na sinasabi ni Yusek Rio kanina doon kay Yusek Cabrera. The relation to Yusek Rio's discussion about the essential of ICT for COVID-19. And then from crisis to disaster, yung mga DRM practitioners ngayon, based from Republic Act 10121 and EU 82, mapapansin ninyo, in the definition itself, meron ng from crisis creepingly going to disasters na. So ano lang, commercial, merong latest info. Alam niyo naman na to, ang confirmed case natin ngayon for today, nakakalungkot po, is 3,954 cases na sa mga kasama natin, mga kababayan natin. We have a total of 89,374 na cases dito sa Pilipinas. Okay, so our next speaker will discuss the medical response in the operational level. So makikita nyo kanina yung discussion ni Yusek Rio giving us the operational environment, the situation that is happening right now. Diniscuss niya what is happening in the COVID-19 response operation, focusing on the importance of contact tracing, the 3 T's, yung trace, tama ba? Test and treat. Okay, that's the situation, and Yusek Cabrera gave us the DRRM. Is it applicable in the crisis or disaster that we're experiencing right now at a strategic point of view. So, susunod, si Colonel, yung ating presenter will be at the operational level na, because the last presenter will discuss in a tactical level. So, from the street situation, strategic, operational, and tactical level. So, the next speaker will discuss the medical response and operational perspective. That's the title. The next speaker belongs to the AFP Health Service of the Armed Forces of the Philippines, Office of the Surgeon General. He serves as the Assistant Director of the AFP Multinational Coordination Center for HADR. Other than being full Colonel of the Air Force, he is a professional pharmacist. He holds a Master in Hospital Administration from University of the Philippines. He specialized health emergency in large population, including CBRNE from U.S. Pacific Command, Hawaii in 2018. He is a local and international subject matter expert on AFP health services, support plans, programs, and policy for health, human resource, medical intelligence, operations, and logistics. So the next speaker is a graduate of the Officer Candidate School, class of number 8. Class 8 po siya ng OCS. Ako po, class 6 ng OCS, Officer Candidate School. The counter ego of the Philippine Military Academy. Okay. Ang ating susunod na magpe-present ay walang iba, ang aking kapatid na si Colonel Marlon. Marami akong kamag-anak ha. Yung unang presenter, tatay. Sumunod, nanay. Yung sumunod, kapatid na. Kapatid. Mamaya, ano yung mamaya? Pinsan o hintayin natin. Colonel Marlon Bayhon. Marlon, are you there? Kapatid.
Yes.
Take it away.
Yes, boss.
Ikaw na. Okay.
Thank
Sige.
you.
Okay.
Bossing, magandang gabi. Maraming salamat.
Good evening.
Of course,
Good evening.
nice to meet you pala si Secretary Rio, nandiyan pala. Sir, magandang gabi po. To Ma'am Che Cabrera. Nakasama po tayo dun sa dinevelop natin yung NDRP po sa Tagaytay. So, kay Doc Ted Isguera, may idol ko. So, magandang gabi po sa lahat. I'm very much privileged po to be with you at mag-share ng ating kalaman, pangunawa at mga posibleng pamamaraan upang makatugon sa ating paglaban sa COVID-19. My topic for discussion is COVID-19 medical response, operational perspective under the lens of DRRM. Next slide, please. Okay. Shown are the references that will guide us on our discussion for today. Next slide po. Disaster Management Preparedness and Response, Operation Spectrum, and COVID-19. As our topic is anchored under the purview of disaster management, specifically operational perspective of preparedness and response, I decided to refer to our National Disaster Response Plan model, depicting the mechanism of transition of activities among thematic areas of disaster management cycle, and comparing it with the current COVID-19 strategy using my own lens with that of the disaster management thematic areas. Sa ilalim ng NDRP, tayo ay ginagabayan ng mga activities na magtitrigger ng paglipat ng hakbang sa pag-address ng disaster o kalamidad. Meron tayong tinatawag na PDRA o Pre-Disaster Risk Assessment. Yun ang hakbang para malaman natin ang kapasidad ng ating kandahan o preparedness papunta ng response phase. At meron din tayong RDNA o Rapid Damage Assessment Needs Analysis at Post-Disaster Assessment para naman maintindihan natin kung tayo ay handa patungo sa recovery or rehabilitation phase. However, in COVID-19, with our current action procedures based on my own observation, ito ay sabay-sabay nating ginagawa as depicted in the model on the right. We are balancing the pandemic preparedness and response to recovery under the concept of health, economic, and security aspect. Next slide. the government's effort to address COVID-19. So, mag-review po tayo ng mga konting polisiya kung paano nabuo ang government coordination structure na ito. Under Republic Act 11469 or the Bayanihan to Heal as One Act, it was enacted and the President of the Philippines was granted the emergency powers to strengthen the government response during the COVID-19 state of national emergency. Under Executive Order number 1683, the National Disaster Risk Reduction and Management Council activated the Interagency Task Force on Emerging Infectious Diseases led by the Department of Health. The IATF-EID serves as the lead advisory body to the President on the management and implementation of necessary actions related to COVID-19. In accordance with Executive Order number 2014-168, the National Task Force for COVID-19 was created where it follows 3 command levels: the strategic, operational, and the tactical. The President of the Philippines is the National Command Authority or NCA, supported by the Interagency Task Force led by the Secretary of Health. At the strategic level, the IATF is the policy-making entity and provides appropriate recommendations to the President related to COVID-19. At the operational level, the NDRRMC is organized as a national task force for COVID-19 response with the DND Secretary as the head, being the chair of the NDRRMC, and the DILG Secretary as co-chair. Next slide, please. Current framework as of July 2020. However, after several months, there were changes in the government structure of framework to address COVID-19. On March 19, Secretary Galvez was appointed as a chief implementer of COVID-19 National Action Plan, equivalent to that of the Emergency Operations Center head under the Disaster Management Organization. At the same time, as head of the National Incident Command and directly under the command of Secretary Lorenzana, who is the National Task Force Chair or Commander, and Secretary Anyo as the Vice Chair. And on July, the Philippine government designated anti-COVID SARS to lead each of the components of the government's COVID-19 strategy, which are under the testing, tracing, isolation, and treatment. All 4 will be under the National Task Force Chief Implementer, Secretary Galvez, who oversees the implementation of the country's National Action Plan against COVID-19. Next slide, please. Para po maintindihan natin kung paano natin i-analyze ang mga data at maintindihan natin ang ating magiging medical response operations, we will look at the July 25 DOH CTREP Situational Report. Ginamit ko po itong data na to dahil hindi ko po nakuha yung bago dahil kami po ay nagkaroon ng isang incident sa pamilya. Namatay po yung brother-in-law ko at kalilibing lang po ng Tuesday. Kaya at yan po ay may kasamang COVID-related po yun. Natagalan po ang paglabas ng kanyang bangkay sa hospital dahil inantay pa po yung COVID test result niya. So hindi alam ng pamilya kung siya ay i-cremate o ililibing. So sa mabuting palad naman siya ay COVID negative kung kaya't siya ay matiwasay naming naihatid sa uling hantungan. Per July 25 DOH CTREP, we will do some analysis on statistical data. As presented, as shown, there were 9.2% or 4,660 out of 50,763 active cases. These 4,660 are categorized as asymptomatics. Now, asymptomatics, wala tayong nakikitang sintomas, pero positive daw. So, nasaan ang mga asymptomatics? Meron tayong TTMFs, yung Temporary Treatment Monitoring Facilities, where they placed under these TTMFs for proper monitoring. How many days did they learn they were asymptomatics from the time they were tested? Or baka sila din ay isa sa mga LSIs. About mild cases, which numbers to 45,629, which gave us the highest number among active cases. Where are they if not admitted to treatment or monitoring facilities? If they are not in the hospitals, who monitors them not to become spreaders? At may breaking news pa po ngayon. Latest of this date, dugtungan ko po yung sinabi ng kapatid nating si Colonel Edwin Sadang. Ngayon po, record breaker. We have 38,075 recoveries. So, eto siguro may mag-iisip ng bakit tayo nagkaroon, biglaang nag-jump ang numero sa 38,000. Ano ang paliwanag dito? May mag-iisip dito. Tayo ba ay papunta sa new classification of GCQ? Kung kaya pinapakita natin nakaka-recover tayo kay COVID-19. Pero ang isa ring breaking news, magsasara ang ospital ng Maynila effective bukas daw. Dahil, matatakil natin yan sa presentation ko. Sa mga drive-thru testing centers, what is the relationship on the current National Action Plan? Testing czar and contact tracing czar. If they were positive under rapid test, but without confirmatory test, due to expensive cost, and of course, our trust sa medical response for COVID is to prevent transmission. Meanwhile, per data, as also shown, critical and severe cases are within manageable hospital care. That is, if they are not competing with the 50,000 plus mild cases kung lahat sila ay naka-admit sa hospital. Next slide, please. The distribution of cases count per age and gender. Maobserbahan po natin na dito sa case count distribution, ang apektado po ay yung age group 20 to 55, which we call the productive age group or the economy builders. They are those who we see in the streets 24/7. Sila yung nakikita natin nagkukumpulan at nag-uunahan makasakay ng public transport services, nasa mga palengke, sa pier, airports, kalsada sa may traffic light, kung naobserbahan nyo, yung mga nangangailangan natin mga kapatid. Marami rin sa kanila yung nakakalimot o nagwawalang bala sa mga pinatutupad ng mga health protocols. Bakit? At kung pagbabasihan na natin sa gender, mas nakakalamang ang mga kalalakihan. Again, bakit? Sila yung madalas nag-iipon-ipon sa baso, sa mga kanto, tabing bakod, grupo-grupo, barkadahan. Ano ang epekto dito sa COVID? Again, ang topic po natin ay transmission, prevention of transmission. Next slide, please. Dito naman po, titingnan natin yung hospital beds and equipment utilization. So, maliban sa NCR, Region 3 and Calabarzon indicates high number of bed occupancy rates. Bakit? Kasi sila ay malapit sa NCR. Yan. Tingnan natin NCR indicates highest bed occupancy rates due to large number and density of population. Ang tingin kasi natin sa NCR is yung center of gravity ng negosyo, kalakalan, karangyaan, oportunidad. And it is also possible na yung mga pasyente from Region 3 and Region 4A, Calabarzon area, Bulacan, Pampanga, are additional hospital clients sa NCR dahil sila ay malapit lamang sa NCR. At posibilidad limitado ang healthcare capability sa kanilang mga rehiyon. Ang NCR kinikilala din bilang isang Healthcare Center of Excellence. Nasa NCR ang mga hospitals na kinikilala natin bilang magagaling, kagaya ng Asian Hospital, St. Luke's, Makati Med, yan po, mga ilan. Then, there are also limited bed numbers and critical care capacity due to expensive healthcare investment costs, number of hospital versus catchment area, and population. Next slide, please. Ano naman ang effect nito ngayon na mga data na to sa health human resource? Health human resource highly affected are doctors and nurses. They are those who are on direct contact with patients. Even those that are not direct patient care, makikita natin ang dadami rin ng numero, matataas din. Saan, ano ang problema rito? Sa nakikita ko po, being in the hospital as Director for Hospital Administration, Operations, ang nakikita po namin dito is mahina po ang ating infection control measures to prevent transmission of infection within the hospital. Another possibility would be yung implementation din ng AWA, yung alternate work arrangement. Because of AWA, nahahawa din yung ating mga healthcare workers kung sila ay umuwi at pagpasok. Ang iba kasi sa alternative work arrangement, sila ay nagpe-perform ng duty 12 hours a day, then 12 weeks, 12 for parang 14 days straight, then 14 days straight vacation din. Then what do they do during the 14 days vacation? Yun, baka sila ay lumalabas sa mga komunidad, namamasyal, gumagala, hindi natin maiiwasan. So malamang sa pakikisalamuha nila sa mga tao, sila ay nakakakuha rin ng karamdaman. The OPD and other clinical procedures consultations are also being done online and or telemedicine. Other non-communicable diseases, ang ibang karamdaman po, ay hindi na rin nabibigyan ng pagkakataong matingnan ng mga doktor. Kasi mismo ang healthcare professionals at pasyente ay takot nang pumunta ng hospital dahil kay COVID. Next slide, please. As we have seen the data of the DOH, no, as our reference, we will now go to the action plan of the government to address COVID, the latest one. So, phase 2 of the National Action Plan on COVID-19 is centered in the containment and management of emerging new cases to sustain gains and continue capacity building and resiliency, rebalance health and economy, localized response. Ito na po yun, localized response, and keep fatality rate low. To localize the response, responsibility will shift to the local government agencies, private companies, concerned sectors, and the individual citizen. Nabanggit po natin na sa National Action Plan na bago, nag-designate ng mga bagong SARs. No? So, for tracing SAR, the Chief Training SAR will be focusing on intensifying skills training for contact tracers and using a contact tracing e-system composed of a COVID-19 data collection tool, a GIS platform, and a link analysis tool. Introduce new technique on contact tracing structure that will include interviewees, the health workers, the investigators, and other members of the tracing team, including analysts, encoders, technical support, and community support teams, or the Barangay Health Emergency Response Teams, or BERTs. For Chief Isolation SAR, he stated that there are 52,223 available isolation beds in ligtas COVID centers or the local isolation facilities, while there are 3,193 isolation beds in Wihil as one mega ligtas centers. They plan to construct more quarantine facilities nationwide. Aside from the existing 129 regional evacuation centers, they are also building quarantine facilities in Region 7, Region 8, Region 10, and in Region 12. For the treatment strategy, Dr. Vega talked about the One Hospital Command, which will be in charge of both public and private hospitals and quarantine facilities in terms of planning, healthcare capacity, among others. Immediate steps that the Department of Health will focus on is to expand hospital capacity by increasing COVID-19 bed allocations, provide additional healthcare personnel even for private hospitals, and provide supply augmentation for all private and public hospitals. For testing strategy, simple statement, they will continue to accredit testing centers and increase their capacity. But they did not give emphasis or make statement about addressing the quick release or real-time test results. So, yan po. Next slide. Medical preparedness and response inputs. In the Armed Forces of the Philippines, our AFP Health Service Support System follows three pillars, namely readiness and fitness, force protection or preventive medicine, casualty management, applicable during peace and crisis period. It involves health and wellness sustainability, preventive medicine prior to deployment, and hospital care to rehabilitation prior to return to duty of injured or battle casualties. As an organization with multifarious tasks, we need to assure we deliver our mandated tasks while caring and looking after the health and wellness of our troops, so with the human resource. To cite, under readiness and fitness, we have our annual physical examination, physical fitness test, immunization program like flu vaccine prior to the onset of flu season, which are done regularly to maintain our fitness and ready to perform our duty. Force protection or preventive medicine activities involves like provision of safety protective gears, tetanus vaccination prior to deployment to firefight mission, and casualty management, which involves our forward and hospital care system. Similar can be done by the government and other sectors to address the current and future health disasters. Next slide, please. As I sailed or fly by on the health statistics per the DOH COVID situation report, analyzing them under the National Action Program. Following are my inputs with highlight or emphasis on how we can contribute in slowing down the transmission of COVID from individual to communities and sectors, and how COVID information will be shared from individual to government under the lens of DRR management and future action for infectious disease preparedness and response. Resolve the delays in the test results that lead to probable transmission. Sana maging real time na ang paglabas ng result ng mga swab test. Wala na sanang fresh case, late case. Kung hindi man, sana yung mga sinubject natin sa testing mailagay sa maayos na sitwasyon sa mga temporary treatment and monitoring facilities habang hinihintay lumabas ang resulta ng kanilang mga test sa pinakamaikling panahon. Ito ay nakasaad na mula pa noong Abril sa DOH Department Memorandum number 160. There were concerns on the results of rapid test. Rapid test po, hindi swab test. As such, those in the drive-thru testing centers. There were positives who confined it to themselves. Bakit? Kasi mahal pag magpa-confirmatory swab test. Kung ikaw ay average income earner, yung sinasabi nating age group, no? And positive ka sa rapid test drive-thru, kasi libre. Are you willing to dole out 1,000 pesos for confirmatory? If not, paano na kung totoo ngang positive ka? Paano ka? Your family, your community, your workplace. Maging abot kaya sana ang swab test at coordinated sa isolation, quarantine sa para mailagay sila sa mga temporary treatment and monitoring facilities at maiwasan ang hawaan habang wala pa ang kanilang test results. Next slide, please. Medical preparedness response inputs for isolation and treatment. Nabanggit natin kanina na health human resource is highly affected. Mga doctors and mga nurses who are direct contact with the patient. Issues affecting this concern catered most on shortage of PPEs, kagaya ng mga naireklamo ng mga nurses ng San Lazaro nung kailan. Alternative work arrangements that result to healthcare workers' fatigue or burnout, aggravated by family distance connections. Notwithstanding moral and welfare shortage of health human resource as product of greener pasture abroad. Hence, following are the proposed. Isolation and treatment, sir, should consider in the existing medical facilities and to be constructed temporary treatment monitoring facility designed to accommodate safety and infection control measures that will benefit healthcare workers and staff. That includes movement of workers, waste management, designation of health safety officers, aside from other existing infection protocols. Review of the effectiveness of the implementation of alternative work arrangement. Nahawa sila dahil sila ay umuwi sa kanilang pag-uwi at pagpasok sa dami nakakasalumuha sa public transport, sa mga communities. There were already existing DOH policies and guidelines to address temporary treatment monitoring facilities or quarantine facilities. Naka-indicate na doon ang proseso para sa step up, step down. Sana makonsider nilang ma-revisit ang mga polisiyang ito. Per my key informant interview sa mga stakeholders ng established temporary treatment monitoring facilities, mostly yung nakadetail ang mga military healthcare workers, hindi nagamit or na-optimize ang utilization ng TTMFs in the early response period. Yung simpleng health facility management team, walang nakakaalam, maliban yung polisiya. Lockdown was implemented but not connected sa temporary treatment monitoring facility policies. For long term, sana makagawa tayo ng Quezon Institute similar concept. Para sa lahat ng infectious disease incident situation we now encountering. So with the past, ay meron na tayong sentro or Center for Infectious Disease Hospital para yung mild cases will not compete with severe and critical care. One hospital or referral system for infectious disease. At the same time, learning institution and probably Center for Vaccine Development for future infectious disease. Mamaya po sa open forum, kung gusto nyo maintindihan yung sinasabi kong QI or Quezon Institute concept, I'm willing to share po sa inyo paano po nabuo yun at ano na ang kanyang kinahinatnan sa ngayon. Also, sana ma-review din po nila ang mga hospital licensing requirements by the DOH as to infectious wards and beds requirement for hospitals. Magugulat po kayo na ang infectious wards po or bed sa level 1 to level 3 hospital ay nasa minimum number lang po. Depende po kung ilan ang kaya nyo. Kasi po, ang infectious control po sa hospital ay hindi nila gaano gumagawa ng mga ward. Kung nasaan ang pasyente, doon nila kokontrol yung infection. Kaya ang infectious wards nila in beds is mostly covered by protocols na lang and policies. Next slide, please. On this slide, I just want to share yung isang design ng quarantine or alternate infectious disease treatment facility that I designed. Ang emphasis po ng design kong ginawa dito is para maintindihan ninyo yung ano ang pagkakahiwalay ng mga direct contact patient care and yung non-direct patient contact care healthcare workers. Ano ang kailang movement? Kung mapapansin ninyo, nasa gilid-gilid lang po dumadaan yung mga non-direct patient care workers and staff. So, nandiyan po sa mga gilid, sa labas ng sentro ng ng pagamutan, yung kanilang movement. So, tanging yung mga healthcare workers. At yung healthcare workers ay protektado po because we have series of disinfection, sanitation, controls, and measures. Next slide. Medical preparedness response inputs for our workforce readiness and preventive medicine procedures for COVID-19 that can be performed by every individual and community, aside from practicing the minimum health standards through contact tracing and information sharing. For health safety practices and prevent community transmission, healthcare waste management information drive ay kailangan po nating i-conduct sa mga communities, eskwelahan, business sector to prevent COVID infection transmission. Nakasentro po ang pagtuturo kung paano natin tinatapon ng mga face mask na ginamit na, yung pong mga tissue pinag-ubuhan, at para hindi ito maging sanhi ng hawaan sa ating komunidad, paaralan, at iba pa hong sektor. Meron po ako isang unpopular proposal. However, pwedeng pag-isipan kung feasible sa stakeholder under the COVID-19 business sector. Marami po tayong nakikita mga online deliveries motorcycles. Sila po ay tumatawid sa iba-ibang rehiyon. Dito po sa amin sa Bacoor, may umaabot po rito nagde-deliver galing ng Bulacan. So kung makikita ninyo from Region 3 to NCR to Region 4A. No? Sana po, kung papayag lang po ang ating mga concerned sector at ang ahensya. Sana po ang deliveries po ng mga online products ay within regions lang po. Para po madali po natin makita, maproteksyonan, makontrol ang transmission of infection, contact tracing, ma-enhance natin ang border infection control and security. At isa pa ho dito, ang driver's safety. The longer na binabiyahe nila ang kalsada, the higher the risk they are in. So, mahirap na po na sila ay magkaroon pa ng vehicular accident. Hirap na po ang mga hospital sa pag-accommodate ng COVID-19, lalo na kung dadagdag pa ang mga vehicular accidents. Public transport sana ay maturuan din at magabayan sa minimum health standards. Maintenance po maintenance, hindi compliance. Kasi ang ginagawa, para lamang sila patakbo na ng mga sasakyan, sila ay sumunod sa mga patakaran. Pero pagkatapos po nun, ano po ang obserbasyon natin ngayon? Sa mga jeep po, lupay-pay na po yung mga nilagay nilang mga plastic barriers. Sa mga bus, hindi na po sinusunod yung pagkuha ng temperature. Lalong-lalo na po yung mga transport sector na hindi point to point. Yung mga may mid-pick up po. So yan po yung mga nakikita natin. Mawalang gana na po sa mga baka may kumakain po, no? Isa pa po diyan, yung kanilang mga cough and spitting etiquette. Yung pag-ubo, pagdura, paninigarilyo nang walang pakundangan. Marami pa rin hong mga driver ngayon, naka-face mask pero naninigarilyo. Then dudura, then uubo. Tayo po ngayon nasa ibang panahon ng disiplina dahil sa COVID. Sana meron ding tumingin sa sektor na ito upang sila ay manatiling malusog, COVID-free, tuloy ang hanap buhay at kapanalig sa pagbangon mula sa pandemya. Next slide please. Ito po ay isang proposal na para sa health information sharing. Part po ito ng medical intelligence na aking ini-introduce sa atin sa Armed Forces Health Services. Pwede po, ito po ay naka-anchor, no? Doon sa gustong ipatupad ng National Action Plan, yung shifting of responsibility from the national government to the local government, to the business sector and other sectors, communities, and individuals. So sa diagram po na ito, kung mamarapatin po, pwede po nating maging kabalikat ang mga estudyante na kung bubuksan na po ang klase at nag-i-class po sila ng electronic class. For example, they will fill up an electronic form that will provide health information related to COVID-19 about themselves, their family, and community, barangay populace, with consideration to data privacy. Data will be forwarded to the involved sectors. From the education sector, aakyat siya, no, sa health sector ng locality hanggang umabot sa local or regional epidemiological surveillance unit. So with their local chief executive. And this information will simultaneously be, dahil ang local chief executive, the mayors, are under the DILG, and with the National Action Plan structure ngayon, they can course it through the NIC and EOC and DILG. While the LGU epidemiological surveillance unit will forward this to their regional OCD. From the regional OCD, it will go up to the OCD, EOC, at magkikita sila ngayon doon sa EOC NIC na aakyat ngayon sa DILG papunta kay chairman or commander ng National Task Force who is the chairman of the NDRRMC. So yung kanina po, tinatanong ni Ma'am Che Cabrera kung pwedeng ma-relate ang ating mga DRRM konsepto sa COVID. Ma'am, ito po ay isang posibilidad po. Ang mga applications po rito, dahil ito ay tungkol sa information communication technology, nandiyan na po ang ating mga kapitapitagang RETT at ERIC subject matter experts. So, ito po. No? Likewise, children of this age are enablers of attitude, of discipline, and future. And who would say they will be the future healthcare workers and professionals. Anong advantage nitong sistemang ito? There will be ease of identification for COVID, suspected, probable, and asymptomatics. It will assist us in facilitating contact tracing, aid in decision-making of the LGU, and contributory to health disaster management data preparedness and response under health statistics, epidemiological data and information of outbreaks, epidemics, and pandemics. Next slide po. In summing up, when pandemic erupts, each one of us, wherever we are, is at risk, regardless of age, gender, sex, religion, color, status in life. Pandemic touch every aspect of society, so every part of society should be prepared to respond and act. Government, so with other sectors such as security, education, business, and community organization should collaborate to develop strategic, operational, and tactical preparedness and response plans and do their roles in resolving health disaster events. With my model kanina ng disaster management thematic area under the concept of health, economy, and security, health workforce, stable economy will lead us to a secured nation. Next slide po. Article to ponder about VUCA and COVID. Marami po nagtatanong sa atin kung ano yung COVID. Yung VUCA po. No? So, ito po, may relationship na po ako na nakuha ang article po. All four characteristics of VUCA are true of the challenges we face due to the coronavirus. Volatility, changes due to COVID-19 are taking place every day. Unpredictable, dramatic, and fast. Uncertainty, no one can predict with confidence when the pandemic will end or when we will have a cure or vaccination. Complexity, the pandemic is affecting all aspects of life, including healthcare, business, economy, and social life in complex way. Ambiguity, there is no best practices that organizations can follow to manage the challenges caused by the pandemic. Next slide, please. With that po, I end my presentation. Maraming salamat po at sana po ay nakabahagi po ako sa inyo ng konting kaalaman ng mga ating matutunan about COVID and how disaster risk reduction management can be a tool in addressing the future pandemics as we learn from COVID-19. Again po, maraming salamat po at magandang gabi sa lahat.
Thank you very much, Marlon. Wala ka sa timing, kumakain ako eh. Sana hinabaan mo pa.
Bossing, sorry.
Hindi, biro lang. Sorry po, medyo nahuli, caught in camera. Okay.
Taking advantage ka, bossing.
Kumain ka muna dyan. Mga takeaways ko lang para sa'yo. Kasi kanina, you probed the situation from the strategic, sabi ni Yusek Rio. Tapos it's strategic from Yusek Cabrera, yung operational kay Brother Marlon Bayon. Nakakatakot na, pababa na ng pababa. Meaning, papunta na sa individual eh. Papunta na sa individual eh. Di ba? Sabi ni Brother Marlon, yung IATF, merong National Task Force. That is strategic, pababa yan, merong regional task force, may provincial, may municipal, may city. Tama ba? Tama ba yan, brother? No? Or, Brad, tubig yan ha? Sigurado ha? Okay. Tapos sinabi rin niya.
Naalala mo yung basa, brother?
Sinabi niya, yung tatlong T, nabanggit din yan kanina, yung treat, trace, and treat. Pero, merong alaman. Test, isolate, test sa akin. May isolate pa uli. Treat, tapos isolate pa uli. Okay. Because just like in any disaster, yun. Nabasa ko lang to, hindi to sa akin. Mukhang sa akin lang. Okay. Sabi nga nila, we need 90% logistics, 5% medical, 4% others, and 1% common sense, man. Okay, so thank you very much, Brother Marlon, Colonel Bayon. Stay put. Kailangan namin yung mga ano mo mamaya. Balitaktakan natin nila tatay ko sa kananay ko. Kaya diyan ka lang mamaya, kuya ha, kuya.
Yes, po.
Okay, so the next presenter, the last but not the least, is he will be discussing the community response at a tactical level perspective. Lagi po natin siya nakikita sa anumang medium ng komunikasyon, TV, radio. He is a medical doctor who specializes in emergency medical response in extreme environments. He has trained professionally and culturally and served in different emergency situations in different parts of the world, global, including Mount Everest. He tirelessly shared his learnings to all interested individuals and groups across the country. He is known as the father of rescue in the Philippines. Ladies and gentlemen, let us all welcome, kapatid ko rin to. Nagkakalat kami magkakapatid eh. Dr. Ted Rescue 1, tama ba? Rescue 1, Esguera. Brother Ted.
Kala ko lolo ang sabihin mo. Magandang gabi. Magandang gabi sa inyong lahat.
Okay, so I will give the floor to you na kung ready ka na. Okay,
Yes,
thank
sir.
you. Gilid mo na ako. Okay, thank you.
First of all, I would like to greet everyone. Welcome to the new normal. We have to be the new Filipino in the new normal. And I would like to thank, of course, si Bong, who is grabing pangungulit na kailangan makasama ako dito, of which I'm honored. And of course, si Yusek Eliseo Rio, kaibigan ko rin sa Facebook, and Yusek Vilma Cabrera. No? Para naman akong nangliit, puro mga Yusek ang nakasama ko. And of course, my colleague na who is into CBRN, medyo para kami ng hilig, who dissected the very lovely discussion about COVID. Pati yung misis kong nakikinig dito na papamangha eh. And si Colonel Marlon. And sa mga sumusubaybay, I hope that we have a perspective on how we look at the pandemic. So I will be discussing mainly, it's just gonna be brief so that we will have a question and answer. So I want to have my slide. First and foremost, yung pagtugon natin sa disaster, first and foremost is we have to note that Philippines is, second slide, is complete in all forms of trouble. No? Pag sinabi na yung disaster, ang ginagamit kasi natin is calamity. They are the same. Disaster and calamity ay pareho. No? We define disaster like any emergency involving lives, properties, environment, even ngayon sa crisis management, yung reputation, that needs external support because the community in question is overwhelmed. Laging merong word na na-overwhelm ka, tapos kailangan mo ng support, no? Or to jack up funds from wherever. Ang calamity is defined as the same, except na ang calamity merong malalim. And all this causes human misery. So, ginagamit natin ng word na calamity, pareha lang po yun sa disaster. Pag sinabing catastrophe, medyo malaki na po yun. No? Interregional involvement, the likes of Indian Ocean tsunami, Chernobyl, Fukushima, kasi siyempre yung radioactive elements ay medyo kumalat. No? Pwedeng hindi lang dineclare, baka umabot dito yung mga isda na nakakain, at pagkainin mo yung isda, you start to glow at night. Now, if you notice, I have an arrow, pindot isa po, pointing to epidemic or outbreak, and of course, pandemic. So, if you notice, my slide has been for 6 years with me. Ang Pilipinas ay mayroon na po lahat, except snow and ice. Pindot po isa sa slide. Isang pindot. No, okay? So, anyway, I'll give you my slide. Ang mapapansin niyo po, pinindot ko lang po yung anything about epidemic or outbreak. Isa na lang po wala dyan, yung anything about blizzard, snowstorm. No? Wala naman tayong yellow. But lahat to ay nasa Pilipinas. No? Both natural hazards and the anthropogenic hazard. Now, each of these must have, of course, a standing incident action plan so that you know what to do. So ganyan po ang ating bansa as described by Ma'am Wilma na halos grabe na yung ano natin, no? We have lots of hazards coming in, like 21 typhoons, and 9 of them will make landfall. 2013 was quite bad because we have Zamboanga seeds, then earthquake in Bohol, Cebu, and then we have Yolanda. And late last year hanggang ngayon ay napasukan tayo ng lindol. Of course, there's bagyo before this COVID. Now, next slide. Now, how do we look at it, particularly in the pandemic perspective? There are books na hiniwalay po yung pandemic. Pag sinabi pong, sabihin ko lang yung word na natural at saka human-induced or anthropogenic na lang. Other books, hiniwalay yung pandemic because it requires special treatment. Well, others maintained in a normal course. Pag sinabi natin nagkaroon ng epidemic on a normal course, pag sinabi ko normal course, one virus or one bacteria went rogue and then it causes like initially outbreak and it went wide scale until pandemic. Pag sinabi naman kasing human-induced, these are engineered viruses. Now, we know that there are engineered microorganisms, the likes of Ebola, Hanta, Marburg. No, you will notice it is discussed in CBRN, of which the previous speaker is also a specialist on that. So meron tayong mga wag na natin pag-usapan kung engineered to si COVID, but doon lang tayo sa perspektibo na kung natural process siya, di natural siya. Kung human induced siya as an item for war, di dito siya sa kabila. But we treat it as the same. Now, I agree na initially we were so flat-footed because everyone, pagkakita kasing virus, doktor kagad yung nasa utak natin. Eh. Now, the doctor will only look at the virus and look at how it can be treated. So medyo hindi kaagad tayo nakatayo kasi parang doctors were just looking at the virus when in fact, it was really a logistics nightmare. No? When you look at pandemic, lahat yan, logistical nightmare yan. Kaya nung time na yun, we were undecided whether to lock down totally kasi by the time na Wuhan virus before, it started to jump out of the fence and beyond borders, we were still accepting tourists from China, no? Despite the fact that other countries ordered lockdown. Medyo, hindi ko naman sisihin natin ang gobyerno, but we were quite confident that there is this West Philippine Sea or the South China Sea that maybe creates a barrier. But unlike before, during the Spanish flu of 1918, wala pang mga eroplano. Ngayon kasi, it's, you know, we have quite number of international airports and flights still coming in. So the preparedness level of pandemic is quite it's really vague unless you are a small nation or a war nation. Pag sinabing war nation, the likes of Israel, maganda talaga preparedness mo. Because you will create kits na panggera na magagamit mo in a civilian environment. In CBRN, because nag-aral po ako ng war medicine, ang CBRN theater, itong klaseng pandemic na to ay under pa rin siya sa CBRN but not in the war scenario. This is the non-war scenario because the in military medicine, we look at this like it's somewhat a war thing, no? Kaya kung nakita mo ang ginawa ng gobyerno, police and military personnel were being deployed because it goes beyond the virus. It might create succeeding hazards like civil disorder because a person who cannot eat like 3 days might, rob someone else's house because he did not prepare himself. Kaya tinitingnan natin, no, kung makita niyo sa first item ko, the human, economic, and societal benefit, no, and increasing collaboration. Remember the word people in pandemic is collaboration. We were coordinating, yes, umangat tayo in cooperating, and the utmost perspective that every human being on earth must achieve is the collaboration. We labor with it together. So this is a horizontal and vertical approach sa societal architecture. Then, if I may quote yung sinasabing site-specific, tapos multi-hazard in approach, time-bound, culturally amenable practices. For example, nagkagulo tayo sa tuob. It has the bad and the good. Nagkalituhan tayo kung okay ba yung luya and bawang. Well, it does not only settle the COVID but other entities because one thing, it adjusts a little bit pH in your body and of course, everyone knows it's antioxidant, good for cancer, no, to prevent cancer. And these are the things na hindi na di-discuss sa Western Medicine Highway. Sa Eastern Medicine, probably okay. So, ang Pilipino, he was flat-footed, facing an enemy na hindi niya alam anong armamentarium niya. In fact, dapat sana meron for number of species, no, that's known to harm man. Actually, there's always a solution somewhere. Next slide. Another thing is the partnership must be, kasama yung PPP, 4 na P. Public, private, people partnership. Kaya mapansin niyo dito, may mga forming partnerships with non-traditional entities like private business, the global health scenario with WHO and others, and civil military response teams. Tama po yung ginawa na military at kasama yung DRR natin na civilian because we are just trying to prevent, sometimes Filipinos, they misunderstand democracy and freedom that they thought. You can see other Filipinos, they insist crossing quarantine area, na karapatan nila yon. Hindi na naintindihan yung scenario gaano. The last but not the least is history. I will not say sorry to everyone, but somehow I don't know if it's part of our educational system that medyo we are not really people of culture and history. Maybe unless you are quite educated na you were because if we look at pandemic since the days of old, per century, we are visited by around 3 to 4 bursts of pandemics, no? And it's not really new, and there are speculations in like the likes of corona, because the beta corona, there are two kinds of corona, the alpha and the beta. Ang alpha, yun yung sipon na nai-enjoy niyo araw-araw. No, it's a coronavirus. When I say coronavirus and electron microscopy, meron siyang mga spikes at may mga pa korte-korte sa dulo na it looks like a crown, kaya corona. The beta corona, these are the MERS, the Middle East Respiratory Syndrome, the SARS, the Severe Acute Respiratory Syndrome, and then the SARS coronavirus 2, which is now your COVID. Itong mga beta, ito yung medyo malala kasi it attacks the lungs of the human being. And in history, since Spanish flu 1918, I read some books that it was a weapon in the First World War. Tapos ngayon, recently, parang hindi na bibigkas yung weaponized. But there's already a learning on that process, like for example, instituting quarantine, from the word quarantenas, meaning 40 days, ideally, no? Just to defeat all forms of illnesses kasi wala pa silang mga detection mechanics, no? Like from microscopy and other laboratory tests to really classify what kind of viruses. By the way, ladies and gentlemen, a virus is a misnomer to be called a microbe. Microbe is shortcut for microbiology. So biology, bio is life, logy is study. So pag sinabing microbes, ito po yung mga may buhay, may cells, the fungi, the bacteria, the protozoa. The virus has no life. It is only encapsulated with the likes of a capsid. And it is only a protein thing. As in, wala siya. And there are more viruses than there are more human beings on Earth. And the viruses are just everywhere else. And it only acts when it enters a host cell. Pag pumasok dyan, three things will happen. Number one, pwede niyang i-cause ng harm, katulad ng dengue, atong COVID, pwedeng wala siyang gagawin. As in, dyan lang siya. Kasi it's an obligate parasite. Hindi siya nabubuhay na kailangan gagamit siya ng cell para pagpasok yung cell, utusan yung cell, paramihin niya yung sarili niya. And the last but not least, ay medyo nakakatulong. Okay? There are viruses na nakakatulong. Actually, there are laboratories right now na nire-reconfigure or ini-engineer yung virus to eat up cancer cells. Kita mo yan? Or to fight against bacteria. Pwedeng patay ng virus ang bacteria kasi mas maliit-liit pa siya, and then it can be, with all the protein templates, idugtong mo lang yan sa DNA ng iyong nucleus, then you can create something else. Now, next slide. The early lockdown issue is a little bit political because we have an afterdraft. Pag sinabing afterdraft, pumreno tayo, pero hindi kagad, alam mo, pag preno ng sasakyan, hindi naman gano'n, no? Pag preno mo, mag-skid pa. So during that time, may pumasok, we started with 2 cases, and we looked at it at 2 cases, and people were just, it's just in Wuhan. It jumped towards Europe, and then we locked kids, and it sprouted like mushrooms from wherever, mainly here, because the kids were located here. So the early lockdown, hindi ko sisisihin, but it's because we have lots of protocols to follow. Because Philippines we have lots of economic relationships with other nations. And the next is the funds, no? Nangyari kasi biglang bago sa atin, karamihang funds parang inako kasi natin dito sa national. There are other positions na dapat the funds were pushed to the region, to the provincial and city. I will discuss about it later. And of course, at the early onset on March, I was talking to some friends at DOH na let's create a COVID czar. So when they asked me what is your perspective of COVID czar, sabi ko, well, ideally, pwedeng doktor siya. Lamang pag doktor who understands logistical science, who understands geopolitics, who understands socio-cultural aspects in looking at things, no? Kasi when you look at the COVID, for me, it's a logistical nightmare. Sa akin, ang virus, 5 lang yun eh. Because the virus is a virus. There's nothing I can do rather than strengthening my immune system. But, getting food, establishing a clear food line, that's the worst problem. So, dapat kung ikaw doktor ka, tapos kung czar ka, dapat ganun ang perspektibo mo. And next slide is yung CBRN template. The previous speaker can relate on this so much, no? Si Colonel Marlon Bayon. And pag sinabing CBRN template, malakihan to. Chemical, biological, radiological, nuclear, and explosive. Because look what's happening right now, it's beyond hospital capability. And then surgical approach in tracing. Well, we have a tracing SAR. Meron po akong nakitang style noon na to track down terrorists. Surgical yun, pangpurok sa kasityo ang approach. No? I-discuss ko yan para mabilis lang ko. And involve the very local LGU in quarantine. Okay, I will discuss it. So, meron ako nakitang problema except military hospital, the likes of veterans and yung biluna natin. Okay? Karamihang hospital sa Pilipinas, tinayo na siyang hospital because we want to create hospital. Hindi katulad sa Israel at saka sa Malaysia na kinrate nila hospital and can do something else. I call it the war hospital. So if you create a hospital because you expect war, then you create a very rigid hospital. Lindulin niya ng 7.2, hindi yun mapabagsak. Pero you have to be honest, no? Itong mga hospitals natin, lindulin mo yan. Sa tingin niyo, hindi yan babagsak sa 7.2. And all people will go to the hospital. It's because ang inisip natin ay something else, just to be the hospital. But if you build your healthcare treatment, yung treatment facility mo like war, then you will build it like there are bunkers underneath and it should be like very sturdy. So yan lang yung nakita ko, kaya medyo nahihirapan tayo. Pag sinabi kasing war hospital, dapat malaki yung ground, ang easement mo malawak. Like veterans, no? Very ideal. Now, if you want to put up tents, then you can enjoy lots of tents in the vicinity. Sa atin dito, ating mga hospitals, nagtatayo ng tent, ginamit na yung kalsada eh. Because it was not created as such. Okay, next slide. So I'll do the practical thing here. So which are measurable. So number one, when we look at COVID, if I am supposed to be the COVID SAR, no? At the outset, pagdating yan, the first information I will give you is I will not take the risk on my shoulder. I will distribute it to every Filipino. Hey, everyone will get the COVID. So I want you to strengthen your immune system and you have to do this and that. So kailangan meron siyang responsibility. Because if I will not give him the responsibility, he will always line up in front of me probably to get the SAP, probably to get updates kung anong tamang pag-wear ng mask. But he is already equipped like he is a soldier on his own in yo-yo, you are on your own. Then he will make it so personal. No? That's one thing. No? Very tactical na ano. Although we are campaigning right now, both DOH and WHO na meron silang mga schematics which I will share to you the mnemonics. Next, have a strong organizational structure to manage pandemic in the community, which we have. Continually assess the needs, identify resources, plan response, and implement the plan. Yes, we have. So, it's ongoing. Kumakain ng budget natin na sangkatutak. Keep the number of the deaths to a minimum. This was being mentioned by our previous speaker. Yes. Kasi other than, COVID is not as dangerous as the flu, but people get scared with the COVID. But I'll tell you what's the scarier. 6 times the number of deaths in COVID is your heart attack. Walang nakakatalo sa heart attack, but no one's scared with the heart attack and the stroke. Yan ang number 1 killer na hindi kayang tumbasan. Ipunin ko yung COVID, gera, aksidente sa araw-araw, hindi nyo kayang tumbasan na mamatay sa heart attack sa ano. But people are not scared of heart attack and stroke. They're scared of pag umubo. Kasi pag umubo, bigla ka magiging abo kinabukasan daw, parang gano'n. Okay, another thing, next slide. Learn from the past. Okay? So titingnan natin how did they settle it. 1918, SARS, and then the sitio purok approach in tracing. Yeah, dito ako. Sa Baguio, ang galing. So last March, I said, sitio sa kapurok siguro natin. I was, explaining it to some guys in Ormoc. Why the sitio purok ang approach? Sitio or purok? Pag naghanap ka kasi ng terorista, ang pinakamaganda, hiwain mo talaga yung community kasi pag may pumasok dyan na bagong mukhang tao, yung head ng sitio, huwag yung buong barangay, pwede malaki ang barangay. Yung head ng sitio, mapansin niya, ay, may bago dito. Then he can approach the guy and call the police. Ay, may bago kaming ano. Mas very personal paghiwain ko pa yung barangay. So that's the sitio or purok approach. Ganon din sa pag-trace, no? Which the Baguio is very successful kasi hiniwa nila. Sobrang liit, no? Na makukuha mo yung tao, yung matitrace mo, no? Next is identifying the critical entities in disaster management. Pag sinabing critical entities, saan ka nagtatrabaho? Halimbawa, sundalo ka. Ikaw ay member ng critical entity under critical facility because the military camp and the police station, BFP station, DRR offices, DILG, DOH, DITC, DOTR, these are all under critical facility. Ang mga tao nagtatrabaho dyan ay importanteng tao. Okay, I will not say sorry ha, sa libro po ito. Ang taong nagpapatakbo ng kuryente, ng tubig, ng naglilinis ng basura, telcos, transport, mga taong nag-aalaga sa roads, bridges, harbors, airports, these are important people. Sa chessboard, ito yung mga opisyales. Kung ako, tagasagip ng buhay, uunahin ko muna sila. I will not say sorry. Bakit ko sila unahin? Kasi sila yung kaagad magtatayo ng lipunan natin. So, ganun po ang triaging dyan. Kaya medyo may mga special favor tayo amongst doctors, police, those who are really working in the front. So this is what I mean. Kasi nung nag-lockdown tayo totally, naglito lahat. Everyone was locked down. Hindi natin na pre-identify yung mga importanteng tao. So pag na-identify yan, mabibigyan natin ng pass, isasama natin sila sa tracing, baka may salimuha sila. Mas medyo madali kasi naka-cluster na sila. Okay? Then another is infodemic. Yung infodemic ay na-discuss sa WHO manual. Ito po yung medyo may problema tayo dito sa Pilipinas. And not only in the Philippines, in other countries. Yung fake news o yung mga information na sobrang dami na hindi mo na alam sinong totoo. So nahihilo ka ngayon. Ano ba talaga? 14 days, 21 days? Ano ba talaga? 1 month or 40 days, 40? Parang ganun kasi lots of positions coming in. I will not say opinion, except the fake news, of course. And that is not very good because kaya nga minsan strictly yung ating information is very critical kasi para ang mga tao hindi gaanong malito. But you know, medyo na-exercise tayo so much, you know, with our radios and TVs and everyone can just post anything lalo na sa social media. Kaya this creates, other than the pandemic, is the infodemic and for the most part, it can be on the bad side. Next is immune system is the key. Ito po yung gusto kong i-enhance. Ito yung pang ano ko, dalawa lang po ipapatay ko sa inyo. Immune system and then the defense line which I call the 12 commandments. So ano yung immune system? Okay, next slide. Ginawa ko lang po ito, new passes. Nung ako po nagkaroon ng pangalawang buhay, yan lang po yung halos sinusunod ko kasi wala pa akong panlaban. Nung ako'y na-admit, nabombahan po ako ng sangkatutak na gamot. Lahat ng gamot na binigay na halos sa nandito sa katawan ko, azithromycin, hydroxychloroquine, binigyan pa ako pang kontra sa AIDS, yung tandem na drugs, binigyan pa ako ng Rozepin third generation cephalosporin. Binibigay lang natin yan, no? Sa combat trauma, pag warak-warak yung cephalosporin binigay sa akin. Binigyan din po ako ng piperacillin, tazobactam. Grabe ang gamot na nasa akin. But despite the fact, kumakalat yung infiltrates ko sa lungs. So what I did is just I accessed nutritious food when I was in St. Luke's. Ala, puro isda. Although medyo hindi ako sanay sa lutuan doon na pack, pero I was just concentrating on fish mainly and then adjusting to fruits. Mayroong fruit sila, saka of course vegetables. My wife was winning and forcing me to eat vegetables also. Then exercise. Yung exercise, no? Meron I can give you the WHO or you can check it. WHO Europe, yung mga home-based exercises lang. You don't need a arena to run around or a circuit. Kahit mga static lang exercise sa bahay. water for hydration. So, kailangan inom kasi good water in the body can facilitate good metabolism. Then prescribed supplements. Alam nito ng ng previous speaker being in pharmacology. Marami pong kumukuha ng gamot na hindi naiintindihan. Umiinom ng antibiotics na mali-mali. Bumibili ng mga steroids na akala nila yun yung gamot. So mali po yun. Ang steroids, it's a very, very dangerous drug. It should be given by the physician with clear instruction from the physician. May mga umiinom ng vitamina, mali din. As in, may umiinom ng vitamin C, 500 milligrams, ang iniinom niya is 4,000 milligrams. Number one, it is economically unwise. Lalabas lang sa ihi mo. Number two, baka ma-overwhelm ang glomerular apparatus sa kidney mo, bumara siya, maging bato, another problem, baka hindi ka madali sa COVID, madali ka sa sakit sa bato. So, kailangan po, kaya nilagay ko sa P, prescribe, para hindi tayo yung lampas or underdose or overdose. Next is air and ventilation. No? If you can access to good air, breathing exercise. No? Pag nag-breathe kayo, pinakamagandang breathing sa yoga kasi ay hindi pinapalaki ang dibdib. Ang pinakamanda is, huwag mo palaki ng dibdib, ipasa mo sa tiyan, palakihin mo yung tiyan mo. 3 seconds in, 3 seconds out. Inhale 3 seconds in, 3 seconds out. Sige ka lang deep breathing para yung lung capacity mo lumalaki siya na exercise. And somehow, good air comes in, it facilitates good recovery because, you know, the fuel of cells are tatlo. The glucose, the oxygen, and of course, water. Then, first S, no, new pass na ako, S is sleep. So, 8 hours a day. Pinakamaganda kung makatulog ka sana mga 10. Manong malabo ngayon na. Kasi sa 10 to 1 o'clock, 10 p.m. to 1 o'clock, dyan po nagre-release ang isang hormone that stimulates the production of your immune system. No? And then the last S is sunshine. Vitamin D is the treatment of COVID according to recent studies. Nagdagdag po ako ng ES kasi meron tayong quarantine pass. So meron akong new pass to the new normal. Ginawa kong new passes. Ano yung E and saka S sa new passes? Ito ay pag-access nyo lang. Number one, evergreen in an elevation. Ano ibig ko sabihin ng evergreen? Makahoy na lugar. It has been a recent findings na binibigay niya ng doctors na if you are suffering from depression and anxiety, isang prescription if they will let you walk in the woods. Remember, it's a Western journal at piniprescribe na you walk in the maraming mapuno na kahoy. If you're a reader of books, Celestine Prophecy tells you so that trees are, they give you an energy, that you can be energized and regenerated. And the last S is sea, water, and sea. So nakakatulong siya sa skin diseases, nagbabad ka lang na nakalubog kang ganito. Mga singers, famous singers, para gumanda ang lung capacity nila, maganda ang kanilang diaphragm, ay naglalaro sa tubig din. Of course, sea is like an ancient thing, isang bagay na ginagamit nila para para magpagaling, ng ibang karamdaman. Okay, so my last slide is 12 commandments. In DOH, they have this BIDA, B-I-D-A. In WHO, they have the 8 rules. Meron po akong ginawang 12 rules. Hindi ko sinabing magaling ako, inipon ko lang siguro lahat, kinumpleto ko lang din. Ang tawag ko, the 12 commandments of safety from COVID. This is your tactical way after getting your immune system, ginagawa mo yun sa immune system new pass, hindi ibig sabihin na kukumpiyansa ka. Then you have to protect yourself with the 12 commandments of safety from COVID. Number 1, letter C, commandments. These are 12-letter word. Cover properly your mouth and nose with appropriate mask. Hindi pwedeng ito lang ang ilong nakalabas or ang mask nasa chin. Mask is a symbol of respect. Mask is a symbol of love, lalo na sa pamilya mo, na katulad kami sa bahay, ng wife ko, nakahiwalay kami. Pag bumababa kami to get food and talk to our family, nagmamask kami. Kasi nirespeto namin sila. Kasi kami, nasa labas kami. My wife is, working in a hospital. Okay? Observe frequent hand washing with soap and water, of course, pabulain, and sanitizing. So, hugas kamay. And then, M, mind the physical distancing. Okay, the word is physical distancing, not social distancing. Here, ladies and gentlemen, we are physically distanced, but we are socially connected. The right word po is physical distancing, hindi social distancing. Kasi social is quite emotional. We are connected emotionally. So we should not do a distancing or cutting it off. What we are cutting off is just the proximity physically. So the ideal distance right now is 6 feet. Tandaan nyo, 6 feet. Another M is mind the coughing and sneezing etiquette. Ideally, dapat meron kang pang ano, kung uubo ka or sipon, syempre may mask ka, lagyan mo pa ng panilito ba tawag na? Handkerchief. Two, may ini-encourage dito. Ayoko pong ganun unless you have a long sleeve. Kasi pag skin lang yan, sulpot din dito, sulpot sa ilalim, wala siyang fabric to catch it. Ang pinakamaganda, to catch the ano, as itago mo na lang dito sa kwelyo mo. Ganito po. Pag nag-ubo ka or sipon, lalo na sunod-sunod, dito ka lang. Hatsur, ubo, and you move away from the crowd because, you know, even if you have handkerchief, pangit po ang pakiramdam mga tao ngayon. Uy, umuubo siya. Hindi katulad nun, pag humatsing ka nun, God bless you, brother. Ngayon, pag humatsing ka, naku, manglilisik ang mata at gustong ipako ka sa krus. Pinapalayo ka nila. Okay, then I go to A. Avoid touching your face, particularly men. Oh, don't touch men. Ibig sabihin, MEN. Mouth, eyes, and nose. So, para hindi ka matempt, just don't touch the face. Okay? Then, N, command na ako ha, never stay or move away quickly from crowded areas. That's very true. Pag biglang nandun ka sa paradahan or lobby, biglang maraming tao, just, you know, move away. Kasi habang dumadami ang density, yung transmission ay mataas. Then, D na ako. D stands for do not go out of your house unless it is necessary. Ibig sabihin, ikaw ay frontliner, pwede, namimili sa palengke. But other than that, para mamasyal or maglaro, no. Okay? Then I go into E. Emphasize in having, commandments. M. Minimize or avoid contact with frequently touched public materials like doorknobs, no, sa common lugar or sa toilet, handrails, as much as possible, don't touch. Okay? And at the same time, if there are extensions of your hand, katulad ginagamit ko, may K9 ako, pang tusok doon sa mga elevator button or sa ATM, that's fine. Or kung kailangan mo magbayad sa LRT or sa bus, dapat sakto na yung pera. Kasi pag binayad mo, tama lang yung one way. Sinuklian ka pa, naging two-way na. Yan ang maging problem. So, dapat eksakto lang yung pera mo. And then, I'll go into E. Emphasize in having air movements inside a vehicle or inside a closed room. Ano ibig ko sabihin nito? Pag nasa room ka, no, may meeting, talagang kailangan up close and personal. So, maintain distancing. Except, allow, bukas ang bintana sa door, and then electric fan. Ang entry ng hangin, isang way lang sa exit. Hindi magkalabo-labo na from all sides nandun sa electric fan. Gagawa ka ngayon ng wind corridor. Parang pag nag-confined space sa rescue kami, gumagawa kami ng tunnel para to get away with the smoke. May positive pressure ventilation. So, ganun din gagawin sa room. Sa sasakyan naman, katulad ko, pag sinusundo ko misis ko, nakamaneho ako, pwedeng sa akin buksan. Pag binuksan ko yung bintana ko, yung sa wife ko, hindi niya pwedeng buksan. Bakit? Pag bukas noon, pagpasok ng hangin, left and right, iikot lang yun sa likod. Walang silbi. Pag bukas sa akin, yung sa likod ko, buksan ko konti, 2 to 3 inches ang gap para meron akong diagonal air movement. Kung ang wife ko bubukas, dito sa likod ko ang bubuksan. So something to that effect, because the recent study for virus not to transmit from human to human in quite a close room is you allow air movement of 6 to 12 movements per 1 hour. Okay, then nasa N na ako, malapit ako matapos. Never forget to sanitize items frequently used or handled, like cell phone, like car key. So lilinisan natin yan kasi nakakalimutan na, wasan. So pinawasan mo yung cellphone, ganun din ang epekto. T, take a bath once you come from work or any place na maraming tao. Mandatory po yon. Okay? Take a bath ka. Pag pumapasok kami sa bahay ng wife ko, diretso po kami sa itaas, gumagawa po ng koridor yung mga pamilya ko. Wala lang. Good afternoon, hi, hello lang. Akyat kami sa itaas, maligo lang, and then, saka na kami mag-interact sa baba with our mask to get our food. So please, mandatory, hindi mahirap ang Pilipino paliguin kasi medyo sanay tayo maligo. The last is S, secure in a small plastic or any bag, lahat ng ginamit mong mask or any PPE, no, sa bahay, in case you have to wear. Kasi ang nangyari, Okay ka na, nagmask ka sa bahay, tinapon mo, nabahingan mo. Yung isang kasama mo sa bahay who's gonna fix it, nahawakan niya, eh walang silbi. So ito yung medyo nakakalimutan natin, yung residual waste. So ilagay natin, kailangan responsible tayo na tiklupin siya, yung labas, pag tiklop mo, ang labas, yun yung nasa loob. And then, kailangan ibaon mo siya talaga para hindi na siya, pag ayusin yung basura, hindi na siya basta mahawakan ng kamay. Okay, so that's the 12 commandments of safety. So, for us to really recover as a nation, every Filipino must play a role. Let's not drill a hole in our boat na para tayong, parang si Doc Ted yung expert na I will batikos you or hindi ganon. Bagkus, palakasin lang. Kung sa tingin mong medyo hindi ka sang-ayon, politically, may bias ka, well, just keep it to yourself. Because I need the TV and radio and prints na mas mapopulate natin ng mga anything about science. Hindi mapopulate na kontra ka dito, kontra ka doon. We are in one boat right now, ladies and gentlemen. Let's not drill it. We will be part of the rowing team para ipapunta natin siya din sa tinatawag nating we heal as one. So, I will give you new pass and then the 12 commandments of safety and then the 5 H's. Okay? The new Filipino in the new normal in a renewed nation must follow the 5 H's. Number 1 H, let's all live in the new normal a life of honor. Number 2 H, life of honesty. Third H, hard work. This is hard work, people. Recovering from pandemic and economic setback is hard work. Fourth H, healthy lifestyle. Okay, let's be healthy. It's a personal conviction. It's not the problem of the president. It is a problem of the Filipino ang healthy. Last but not the least, humility. If all fails, kailangan natin maging maayos sa buhay, humble ka lang. Pag humble ka, maging kind ka. Pag kind ka, you will always be right. With that, thank you very much to the organizing team and thank you that I'm so honored to speak with patriots. Mabuhay po kayo lahat.
Okay, maraming salamat, Dr. Rescue 1. Very informative at the individual and tactical level. In fact, what I'm getting right now is parang ang frontliner talaga yung sarili natin, no? Pansarili talaga. From the ang sinasabi nga nila from bottom up ba? Bottom up. We do not rely on the government lang. Kaya nga sinasabi natin whole of nation approach. Andiyan yung public, which is yung mga national government, andiyan yung private, yung mga businessman, other companies, and andiyan yung people, which is yung tayong lahat. So P plus P plus P is equal to zero casualty. Of course, with the guidance of our Lord Jesus Christ. Before we go to the question and answer, I would like to welcome, may kasama daw po ako dito eh. Salamat po Papasok si Engineer Mikey. Before
Hello everyone to our distinguished speakers.
Okay, so we would like to recognize the organizer, RETT-PH, of course, powered by Eric and the Engineering Circle, yung founding member po namin, and the institutional members, nandiyan po yung ICEP Foundation, React Philippines, Ham Radio Cebu, Project Agos, Bike Scout, Asimut, PG Cloud Incorporated, EES, Distinguished IGMS, of course yung Plasco Sandugo Corporation, our partners, Ilrads, of course yung ating Education Training Doctrine Command, Quiapo Church, our supporters, Gasak, Batangas, CESAP sir, nandito rin na CESAP, and CGSC. Yung mga ibang logo, pasensya na po kayo, paliliit eh. Pambata po yung mga logo nyo, hindi mo mabasa na matatandang katulad. Okay, so we are very fortunate. Maraming salamat po sa ating mga speaker. Yusek Iseo Rio, Yusek Vilma Cabrera, Colonel Mayhon Marlon, and Dr. Ted. At this point, Mikey, siguro take the advantage to shoot the first question. maximize kahit
Okay.
yung mga expert
Comment
natin.
Also, comment ko lang din for Dr. Esguerra. I agree with Dr. Esguerra that it has to start first with ourselves. So yung mga etiquette, mga typical etiquette, basic etiquette with coughing, syempre pa nare-remind tayo ulit na we should do it. So let's take care of ourselves, but also let's be mindful of others by observing physical distancing. So for our participants, meron po tayong Facebook Live and YouTube. So, we will be able to see all your questions on the comment section. So, mag-type lang po kayo doon. Then, you'll be able to see it and we will be happy to address all your questions.
Okay? So, may question na ba, Mikey?
Ang unang
Oh.
question,
Okay.
there's
Okay.
there's only one question when it comes to the telecommunication. So I don't know who's willing to answer it. Pero how is the communication going now ngayong COVID-19 po when it comes to like different government agencies? How are we cooperating with one another? So meron po bang mga struggle when it comes to communication, or we can see the smoothness of every government agencies helping each other to achieve like what Dr. Esguerra said, we heal as one.
Anybody, sir, ma'am?
Yes,
Yes, sir.
well, I'll take it as a telecommunication industry, no? Kasi napakinggan naman natin ang presidente, no, na parang inarticulate niya, inisona yung mga reklamo ng mga kababayan natin, no? That telecommunication as a whole, even in normal times, no, not necessarily may disaster or may pandemic crisis, no, has been very bad. In other words, hindi hindi nasasiyahan ang ating presidente, no. Of course, galing to rin sa mga reklamo ng ating mga kababayan, no. And basically, itong pandemic na ito brought out or focus doon sa kailangan natin. Yung telecommunication pala is very important as building roads, as having electricity, as having water. In fact, it is now recognized as a basic human right, no, na magkaroon tayo ng access to telecommunication. Of course, we feel this kung mayroong disaster, kung mayroong pandemic, na very important ang communication para makapag-respond ng mabuti ang gobyerno natin and para makabigay ng magagandang decision para yung limited resources natin ay will be fully utilized to the most effective way, no? So diyan dumadating ang communication. Of course, ang ating communication are from commercial telcos, no? Doon tayo maasa. And kung dumating ang isang malakas na bagyo like Yolanda, ito yung bumabagsak, no? So ang government natin, kaya nga mayroon tayong RETT na na talagang advocacy ng ating masipag na Edwin ay talagang laking tulong, no? Dito naman sa pandemic na ito, walang bumagsak na cell site or walang na-disrupt, naputol na mga kable. Pero sa dami natin na nag-access sa internet, no, because of the lockdown, ay of course naapektuhan yung serbisyo, no, ng mga telco. Kaya isa rin tong sa binanggit ni Presidente sa SONA niya, no, it has to be improved. Ang kwan ko lang dito is dapat yung DICT at yung mga telcos, NTC at mga local government units ay mag-coordinate, no? Siguro before the first week of itong August, no? Itong coming August ay malaman talaga kung ano yung realistically na magawa natin to improve our communication by December, no, yung deadline ni Presidente, at yung measurable, no. So tatanungin ang mga telcos o ilang towers ang magagawa nyo up to December, no. At alam nyo naman yung mga telcos ay hindi pundo ang kulang sa kanila. Ang kanila is yung mabigyan sila ng mabilis na permit para makapagpatayo sila, kasi sa ngayon, 1 taon ang kailangan sa permit lang, pagkuha lang ng permit. So yan, kung sabihin na pag nagpulong o sabihin ng LGU dito sa amin, 3 araw may permit na kayo. So yun, mako-compute ng mga telcos at mayroon na tayo ngayong mga common towers providers na makasabi, o sige, sa buwan na ito, let's say August, no, mag-umpisa sa August, makapagtayo tayo ng mga 500, no. Then siguro sa September, Berna, 1,000. Kung makapagtayo tayo ng about 4,000 up to December, ang laking bagay yan sa pag-improve ng ating communication, no. So ito measurable. At ang magsasabi na kaya nila are the telcos themselves o yung gagawa ng ating common towers, no? So that will address yung ating yung utos ni Presidente na to improve our telecommunication by December. And of course, alam niyo naman, sa itong coming school year, kailangan yung long distance learning, no? Kasi palagay ko, wala pang vaccine tayo para makapag face-to-face ang turo ng mga estudyante natin, no? So, kailangan talaga ito yung, sa new norm, ito na kailangan connectivity talaga. So, yun. So, hindi katulad ng Yolanda, after 2 months, na itayo na kaagad ng mga telcos yung cell site nila sa Leyte. Ito, walang natumba na cell site, no? Pero kulang, dito nakita kulang talaga ang cell sites natin, no? Yung infrastruktura natin sa telecommunication.
Okay. Mikey?
Yes, I agree that it should be measurable at the same time, time-bound. Diba? Kasi pwedeng magsabi ng plan pero walang action. So I agree that it should be measurable at the same time, time-bound. So may napanood po ako, share ko lang, before sa Korea. Meron silang similar, di ba meron po tayo pag may earthquake sa Philippines, may message tayong nare-receive. Possible din po kaya yung for COVID, like we have to always remind the people, especially na a lot of people nowadays are not tuning into news and sa television or radio, or is it possible po ba na through their phones? May plans po ba ang government when it comes to?
Actually, yes, ginagamit natin yung announcement, no, of na actually I was there when we had this pag-blast ng mga text messages sa lahat ng doon sa mga affected areas na mga itong mga warning, no, that was started 2017, no. So mayroon pa tayong yan nagsasabi na sa lugar na ito mayroong magdi-distribute ng mga amelioration. Yun nga, palagi sa social media naman ay sinasabi na you wash your hands, social distancing. Hindi nagkukulang yan, no, sa ating ginagawa. Pero yun nga, tama din na dapat ito ay mas paigihin natin, no. Kasi hindi katulad ng isang bagyo o isang flooding condition o isang landslide na i-warningan ka lang, sige evacuate kayo, punta kayo sa evacuation center. Ito yung evacuation center natin, bahay natin eh. Doon tayo. I mean,
This is the safe zone, sir. Safe zone.
yes, oo, tuyukan tayo. Kaya nga tama si Doktor na talagang ang laban na ito ay hindi talagang nasa individual talaga, no? Maghugas siya ng kamay, mag-face mask siya. So, iwasan niya ang makakontak.
That's right. Alam mo, sorry sir. Mikey, alam mo ba, meron tayong tinatawag na Republic Act 10639. When I was still in NDRMC, kasama namin sila Yusek Cabrera, ginawa namin yan na it's early warning broadcast system using a cellular signal, cellular platform. Kasama rin yung telcos dyan. Yung ginawa namin yan. Kasi Commissioner Cabarrios pa kasama namin doon sa NTC. So, we drafted the rules and regulations. Kung mapapansin mo yan, yung mga cellphone mo, naka-receive ka na ba yan, Mikey?
Yes. Yes.
Yeah, that is the Republic Act 10639. Meron tayo na yan, sinasabi ni ma'am. That's why, question mo kanina, itusok ko lang ha, regarding yung communication na sinasabi ni Presidente, sinagot ni Secretary sa telcos. Ang dapat ngayon, we are now in the state of crisis and disaster. Yung crisis and disaster communication naman na. Which is, ano masabi mo dyan, ma'am? Usually, nung nandun tayo sa NDRC, yung crisis communication, crisis imagination, disaster imagination, lagi nating nababanggit yan. It's a common words nung nandun tayo. What can you say about that, ma'am? Yung crisis and disaster communication. How important it is, right?
It is very important actually. Parang sabi nga ni Sir Eliseo na in this time of crisis, connectivity talaga is yung vital part. Especially na lahat tayo is from house to house lang, so magkakalayo. So we have to establish that communication. So parang yung nag-gets ko rin yung point ni Sir Eliseo na I agree that we have that, pero we have to improve that kasi there are rooms for improvement still. And at the same time, hindi lang naman reliant tayo sa communication. We are also reliant to the discipline of each person, of every person here in the Philippines. So even though that we warn them, that we tell to them stay at home or we broadcast it, kung pasaway talaga ang tao, pasaway talaga ang tao. So talagang dapat mag-start sa atin yung discipline.
Minsan, Mikey, dapat takutin mo talaga eh, di ba? Just like,
kasi
sige, go. Ikaw na. Ladies first.
Sir, kulo din. Parang nag-exam kasi ako nung last time, Saturday. Tapos near Mega Mall.
Exam na?
Basta may exam ako, sir, na in-attendance. Near siya sa Mega Mall. So may binili kami nung kapatid ko. Nagulat ako, pagdating ko sa Mega Mall, ang daming tao. So parang, ano nangyari? Parang dapat stay at home. Pero ang daming tao. So, hindi naman dapat hindi tayo maging complacent when it comes to this. Especially nasa quarantine pa rin tayo. And the more na hindi tayo naging discipline, the more na tumataas yung number of confirmed cases. And hindi lang naman sila yung affected. Lahat, buong Philippines is affected.
Siguro, Mikey, tingnan natin. Maganda yung kwento mo eh. Pang millennials lang katulad natin. Pero, siguro puntahan natin yung crisis communication na how important it is. May we ask Yusek Cabrera, ma'am, any comment or statements about crisis or disaster communication? Ma'am Che?
Actually, ito yung sinabi ko kanina, no? Of the clusters, yung ETC is very important in terms of relaying to the people ano yung not only the disaster, no, but not only the hazard, but what accompanies that hazard. So in communicating, um, importanteng makikita, madinig ng mga tao kung ano yung pwedeng mangyari sa kanila. Kung ulan ito, ano yung posibleng kasunod na mga implications ng malakas na ulan? Kasi landslide, posibleng pagkabuwal ng poste o pagkabuwal ng puno na doon tatama sa kanila. Hindi lang basta nasabihin na uulan bukas, uulan mamaya, at ito yung lakas, no? So, parang kailangan talaga in communicating disaster or a crisis, malaman ng tao ano yung parating na crisis o parating na disaster, ano yung nangyari sa kanila, at ano yung dapat nilang gawin. Thank you.
Okay. That's ma'am.
Can I share?
Yes, Doc Ted. Go ahead, please.
Okay. We human beings, we lasted beyond dinosaurs because we have the skills to collaborate, and that's the essence of communicating. No, dinosaurs don't do that, despite the fact they're bigger, stronger. But we overcame mammoth, our mga predecessors natin, pinatay yung mammoth na malaki because we tend to talk like, we communicate. So the essence of communication is so vital that it's the primary, it's the middle, it's the last. No? Because for example, if we achieve collaboration, communication is very important. Synchronicity, collaboration is very important. In extreme scenarios like crisis na, communication is still important because a person who does not know will be an enemy. Pag hindi niya alam, kalaban mo yan, magiging kalaban mo, magiging balakid yan kasi hindi niya naintindihan eh. But if there's like a breeze or communication and we let them understand situations, then we can para magiging ally natin siya, particularly in pandemic. Like for example, all people must follow the 6 physical distancing, the distance. So kung I cannot just shout it, but we can toss it over the internet or yung sabi nga ni ma'am kanina, ni engineer, yes, nakakatanggap po ako ng update sa pandemic galing mismo sa DOH, nasa Viber nga lang. But at least my Viber is receiving it. But at least DOH communicating with me. Okay? So it's very vital. And I think pag hinug ang communication natin, palakasin talaga yung campaign ni Yusek Eliseo Rio, we can become more agile and we can make things done. And particularly in recovery, lalo na sa mga tao, in re-educating our, kita mo, isang balakid, hindi na-educate yung ibang mga bata kasi walang signal sa malayo. So, masisete natin itong isang part ng isang area na non-contact education, pero yung iba wala because probably we lack infrastructures wherein we have to invest so much. Because whether we like it or not, in new normal, this is how we will do it. Probably for the next 2 years, we will just be doing Zoom or Webex.
Yeah.
So, thank you.
I agree, Dr. Ted. In fact, yung sinasabi natin communication kanina pa, even while communicating, Mikey, we should be learning dun sa what we are communicating. That's why dun sa lecture ni Colonel Bayon kanina, may nagsuggest thank you from Mr. Rene M. Portuno. Sabi niya, Colonel Marlon Bayon, I suggest to Colonel Marlon to include the education dimension in his COVID framework of action, considering the magnitude of the student, teachers affected by the pandemic and their great potential. So, pwede mong include daw yon, suggestion niya, which is ito na nga, pinag-uusapan natin, ay good communication. So, anything, Colonel Marlon?
Go ahead. Included na yun doon. Siguro hindi lang niya narinig yung advantages nga noon. No? Kaya nga, sa yung education sector talagang isinama natin. Kasi through that, kung i-involve mo yung mga estudyante, doon mag-isimula yung learning nila, awareness nila, hanggang appreciation. Kaya nilagay kong advantages doon, baka nga sila yung mga future healthcare workers and professionals natin, tsaka yung mga pandemic and health disasters warriors pa natin. No? Now, going on the side of communication na previous pinag-uusapan, lahat kayo, puro mga angels advocate eh. Magde-devil's advocate ako in terms of communication. Kasi ito, seryoso to, pansinin nyo. Ano ang nangyari, alam nito ni Kuya Bong, kung nakikinig siya, ano ang nangyari ng April 9 and succeedings? Because of communication. Nag-communicate about COVID lockdown. Ano naging reaction ng mga tao? Panic buying. Puntahan ng palengke without the observance of, yan na yun. Yan yung devil's advocate. So sana kaya ang magandang mode of communicating that it will not create chaos or panic sa mga tao. At lahat-lahat magkikita sila sa common areas, nag-uunahan, then yun na. Wala nang wala nang physical distancing, wala na lahat, nakalimutan na. Basta parang survival mode palagi tayo. So yun ang isang areas na siguro masagot natin.
Okay. Thank you, Colonel Marlon. Bago ko ibigay muna uli yung next question kay Mikey, pasalamatan natin yung 73 na nasa Facebook, saka more than 400 sa ating live streaming. Marlon, meron yata, Mikey, may sa screen? Ano yan? Engineer Mikey, research and studies show na majority of Filipinos are compliant and that the reason for so much COVID widespread is due to institutional lapses. What can you say about this po? Para siguro to sa para sa iyo ba yan, Mikey? Kaya mo sagutin? Hindi, sa mga panel members natin. So, galing po ito kay Mr. Tangonan. Sorry for the, hindi ko So, ulitin ko lang po.
Rembrandt.
Oo. Pakibasa nga, Mikey, para paulit, para masagot ng mga
Research and studies show na majority of Filipinos are compliant and that the reason for so much COVID widespread is due to institutional lapses. What can you say about this po? Thanks. So, for me, magsabi na akong thoughts din. So, thoughts ko lang. So, though there are research and studies about the majority of Filipinos na compliant, I guess there are Filipinos din sa atin, personally, may lapses tayo. At the same time, the government has the lapses too. So there are kasi kung tayo, wala na tayong COVID case. So lahat tayo COVID-free na. So I think everyone naman is may lapses when it comes to that. That's why I agree with Colonel Sadang that you have to learn. If you fail, you stand up, learn from your mistakes, and move forward. So yun yung tingin ko. Pero I don't know kung sana ganun yung perspective ng lahat. So, ganun hindi lang yung each individual na commoners, but also sa government, mga nasa government na position. So, sana ganun din yung motivation. Kasi kung wala tayong motivation to move forward talaga, masustagnate tayo dito sa position natin na ganito ngayon. Magko-continue lang mag-direct yung number at the same time, walang mangyayari. So, sana ganon lahat as individuals. So, yun.
Okay.
So, for
any comments po from the panel about the question? May compliant daw yung...
Yeah, okay. Sige, sagutin ko lang. No? I don't see it na masabi natin na totally it's institutional problem because DOH has already a pandemic plan. Part of our DRR, sabi ko nga sa'yo, marami na yung ating mga disaster, tinatamaan na natin yung side ng infectious outbreak. We just probably don't like to put there the pandemic. So meron tayong mga outbreak or epidemic plan. Nilagay lang natin sa DOH. The only thing is we were just first and foremost, we are not a researching unit talaga, unlike CDC. In the US, they have CDC. Tayo, recipients lang tayo kung ano ang output ng Japan, ng US mainly. Kasi we are, being a doctor, ang education natin is US style. So hindi pa natin kaya yun kasi medyo kulang pa tayo. Even biosafety biosafety level 4 na laboratory, medyo hindi natin ma-enjoy yan across the country. So we are getting things. During this getting of things, there are campaigns already na materials that DOH has been releasing kasi meron tayong SARS. Ang problema lang is the Filipino probably did not process it so much. No? It's just like Yolanda. Nang sinabi, humayo kayo dyan kasi darating ang storm surge, hindi na-process yung storm surge. Hindi na-intindihan eh. So si COVID-19 parang abstract sa kanya na the thing that he does not understand, parang sige lang, wag muna. Kasi mas unahin ko yung saan ako magkakapera to put food in my table. So institutionally, it's there. Isa sa pinakamagandang disaster management, kasi I've been traveling around, ang Pilipinas po, na isa batas natin, ang ating mga nagtatrabaho ay nasiswelduhan sa tamang ano. You go to New Zealand, their Coast Guard is volunteer, no payment. You go to Chile, their firefighters are volunteers, sa atin bayad. Ibig sabihin, lahat naka-structure sa atin. It is only maybe how we interpret things because these are quite not really common things. And being Filipino tayo, kasi we are still struggling to go up economically, naka-apekto sa mindset natin, very myopic lang sa atin ang mga major events. Nobody knew about 2018 Spanish flu. In fact, I will have the template of Yolanda para maka-relate kay lahat. Balikan niyo ang Giwan kung saan po namatayan ang mga tao doon sa lugar na tinamaan ng surge, nandoon na rin sila tumira ulit. So ganun po ka-short-sighted, probably because we cannot just really adjust so much and so well because of the economic setback. So hinay-hinay lang, no? This thing is not being cannot be solved overnight. I still believe in the process of create dynamism na maintindihan natin. Maybe this pandemic is here for us to really understand that there will still be again like this, maybe in 50 or 100 years. But the good thing about these people is let's refrain from being so negative almost all the time, because me being a survivor, I look at it in a positive manner. Okay? I don't say that you are wrong with your question. The only thing is there's nothing we can do. Maybe if you think it is an institutional setback, well, on your position, for me, actually, it's not. I call it's my personal setback. Hindi lahat tinamaan. Probably because their immune system is better than me. Yung taong grasa, hindi tinamaan. Ako tinamaan. Baka I'm more sanitized, kaya ang immune system wala. But you know, the positive thing of what happened, ililihis ko lang away from sa riles ng tanong ko. I took it in a positive note instead of, blaming people around. I am more closer to my family. I'm locked down inside my house. When I look outside, the environment is greener when I look at trees. I tend to pray some more. My family tend to pray some more. And people are collaborating. Scholars from a not so friendly nation, Chinese scholars, doctor scholars, and US scholars are talking. So I look at that manner. No, because right now there is no clear solution really on how we can do this, because the only hope is only a vaccine. But the only thing we can take from home right now is just please be safe, follow the 12 commandments, and enhance yourself. Whether prepared or not, prepared ako, to tell you honestly. My house is ready. If I can tour you, my house can survive for 1 month. Buhay kami dito, lindulin. Pero ako yung nang natamaan ng COVID. Ibig sabihin, sablay ako. So, yun lang. Ang ano natin is, sige lang. I'll give you the freedom to, that it's an institutional. Ako naman, I'll be taking it na institutionally, it's there. Hindi lang siguro natin nabasa sa DOH portal. But it's there. Probably because I'm opening other than I'm so much with the Facebook there and watching TikTok. But everything is there. We have best people. When I say best people, I've seen people in DOH, they're working so well. They're okay. I know them. San Lazaro guys, despite sa scarcity meron tayo, but we are fighting it out. We are being recognized by Spain and recognized by some, in the medical society that we are quite doing so well. Bakit lang tayo dumami? Well, it's because hindi nagkatugma ang number of testing kits. Gusto ko lang maintindihan niyo yan. By the time siguro marami na, nang dumating, dumami. And we really did not understand it so well. By the time na dumadamihan, dami ng testing, maraming testing, lumilitaw ng marami. It does not mean that we are not really, we are quite hard-headed. I don't think so. It was just an issue of logistics again. Kung meron akong millions of logistics in my hospital in a stockpile for almost all illnesses like the US, then I can have very good statistics right away. But wala ako eh. So I will just take it like it's a negative part of me, but it does not mean I'll start blaming or I'll end my life somewhere. Again, the best thing we can do is let's just, if I'm not amenable, there are things I'm not amenable with DOH, of course. But the only thing I can give is I'm being kind by, hey, perhaps we can do this one. If they don't do it, sige lang, push it some more. Like for example, sa Wuhan, okay, modesty aside, tinanong po ako ng DFA, ano pong gagawin namin sa Wuhan, saan dalhin? Nag-suggest po ako Central Luzon. I did not say Subic, dalhin Central Luzon kasi they were planning to bring it to Carvalho Island. I said no, maraming encounter. From the airport, isasakay sa bus. From bus, isasakay sa barko. Sa barko, maraming tao. I don't like it that way. Pagdating sa airport, isakay sa bus, dalhin na lang. I would suggest Central Luzon area, maybe in a military camp or elsewhere. So voila, they had this athletic camp somewhere. I'm happy. And sending DOH to Wuhan is a suggestion ko sa DFA. Why don't you send, instead of getting these people from Wuhan, you don't know because you're not doctors, bring DOH with you to assess, so that we can triage it there. And they did it. And I'm happy. Even if they did not mention it came from me, but I'm okay. Because as a citizen, I want to do my job. I will just answer it when I'm in heaven. But right now, I'm just okay. Ayoko magdagdag ng bigat ng pasanin ng mga nasa DOH, nasa OCD. Gusto ko ako ay contributory din na sa pagbabago. Yun lang po. Thank you.
Yeah. Well said, Doc Ted. Ang bawat approach kasi talaga, it should be systematic. Every parts of a system should be working para masolve ito. We are at war. Ibig sabihin, hindi lang naman ako, hindi lang kayo, lahat tayo. So kailangan magtulungan. Kami sa military, naiintindihan namin yan. Everybody counts. Any comment from the panel? Kung wala na, may yes, si Colonel muna, then Colonel Bayhon. Go ahead, ma'am.
Okay. Just briefly, yung pagdami ng COVID cases dito is a combination of several factors. Una, on the part of the institution, this is government, it's doing its part, kaso yung dynamics ng virus, ng COVID itself, ay evolving. Meaning, hindi pa talaga natin ma-pinpoint paano siya hawakan sa liig. So, evolving pa siya eh. Now, on the part of the people, again, the communication might have been reached or kumbaga received by the people, pero marami ring factors doon sa mga tao kung bakit hindi sila nakaka-comply. For example, kahit ikaw ay nakatanggap ng paabiso na ganito-ganito sa inyong neighborhood ay meron ng 3 o 5 positive cases, hindi ka pwedeng tumigil lamang kung ang iyong pamilya ay merong problema sa pagkain. Okay? Yung vulnerability and susceptibility ng pamilya mo, yun ang una mong consideration eh. Kahit mamatay, basta magkaroon ng pagkain para sa pamilya, yun yung mentalidad ng Pilipino. So it's a combination of several factors. Hindi ko lang masabi na mga matitigas ang ulo ng mga Pinoy. May katigasan nga, pero hindi naman hindi natin kumbaga, we're not heeding to whatever advice of the DOS, the World Health, pero may rason yung mga pamilyang yun. So siguro, dahan-dahan, tama yung sabi ni Doc Ted, dahan-dahan magkaroon din ng, kumbaga, resolution or solution doon sa mga problema related to COVID. But it may take time. Siguro, hindi nga lang itong 2020, but maybe for the coming years pa. Another 1 or 2 years pa. Again, yung mentalidad nating Pilipino pag minsan ay ang tingin natin para tayo Superman. Maraming bahala na factors na sinusunod ng ibang mga tao, ibang mga Pilipino, kaysa ano yung dapat mangyari, dapat gawin. Okay? So, may mga factors na dapat balansihin at yung understanding, yung appreciation at yung action ng tao ay hopefully magkaroon ng katinuan kung naiintindihan nila yung mga mensahe.
Agree ako dyan, ma'am. Kasi we work as a team dapat eh. Parang isang pamilya rin yan. Huwag mong insist yung gusto mo. Oo, kasi pamilya kayo eh. So, thank you, ma'am. Colonel Bayhon, may sasabihin yata, Mikey?
Dagdag lang, no? There is no hard and fast rule solution ngayon para kay COVID. Tanda natin na yung kanina binanggit ko nga, no? Kung ma-recall niyo yung VUCA, yung volatility, uncertainty, complex, and ambiguity. Yan si COVID. Hindi natin siya kilala. Even the health experts globally ay nahihirapan. Nag-aaway na nga si Trump at si Fauci, di ba? Kagulo na rin sila.
Trump, oh.
Diba? Kaya nga wala pa tayo talaga. So hanggang ngayon, pinag-aaralan si COVID, paano ma-defeat. Sira nga ang namin dito eh, yung aming secret eh, ng military. Hindi namin alam ang friend, yung enemy force, dami kilala hanggang ngayon. Ang dami ng friendly forces.
Okay. Okay, Mikey? May lumabas screen?
Okay.
Ano yan? Last question? Or we are violating the 12 commandments of Dr. Ted na eh. Diba? Oh, may question, Mikey.
Ilang hours na lang
So, sige
natin.
Tayo for the last question.
Cheat day.
Last question na po
Last
tayo
question na
since
yan, Mikey.
medyo late na rin. So, for the last question, how can we be sure of the information about COVID in social media where in fact there is a proliferation of fake news? Does this hamper communication with LGUs and the public? So how can we distinguish the fake news dun sa real news?
So, sino pwedeng sumagot? Kasi parang nabanggit na yan kanina, di ba?
Communication.
Well, yeah. Well,
So again, communication.
Ellie, Sir
Well,
Ellie.
yeah, when the pandemic started, no, March 15, I was still with the ICT then, at proliferate yung mga fake news actually, no. If you remember, naging issue yan. In fact, yung ating PNP was already activating yung kanilang cybercrime, no, units nila. Pero nagkuhan kami sa DICT na kami yung cybersecurity, no, na mayroon tayong platform sa DICT that I procured when I was the acting secretary, no, at gumagana ngayon, where we can more or less track, no, kung saan nanggagaling yung fake news, no, up to the address ng kung saan IP address nung saan yung nag-originate noong fake news, no. Kasi yung fake news parang virus din yan eh. May source, then may kumuha niyan para i-transmit niya ng sarili niya, then nagta-transmit yan, no. Pero yun nga, yung yung ating platform can actually point yung source. At nakatulong to, no? Nung nag-umpisa na yung PNP na nalalaman na kung saan yung source ng mga fake news, may mga nahuhuli rin, no? Ang fake news actually kaagad, no? Kaagad kung may nagpadala ng fake news, ang sinasabi lang naman natin sa mga netizens, no, yung nasa social media palagi ay yung kwan nga, no? Think before you click, no? Ito ba'y dapat ko i-transmit o hindi? so then mayroon tayong ginawang parang hotline na sa DICT na kung may citizens na gusto magtanong kung itong nabasa niyang posting sa Facebook or sa social media, ito ba'y totoo o hindi, no? So kaagad masasabihan siya na yan ay hindi totoo from the source itself, no? Kasi for example, the news is about yung mga presyo kasi noon ng alcohol. Matanda niyo yon, nagkaroon ng ng mga alcohol, no? Bumili ng drum ang kwan, tapos ikakanila, tapos nagkakaroon ng ina-advertise nila yon sa internet, no? And doon sila minsan nahuhuli. So actually ang kwan yan, ang to fight fake news is talagang information drive, no? Na actually ginagawa ng DICT yan, lalo na to prevent yung mga scammers, no? Ito yung mga naggagawa ng mga nag-i-scam ng pera sa mga pati mga SMS ginagamit sa panayan, no? So yes, pero ang kinakuha namin is basta nagkaroon ng labag sa batas, it becomes a responsibility of our law enforcement agencies, no, yung PNP. So labas na ang DICT doon. Pero we help them in locating yung lugar na kung saan nag-originate yung fake news. So yun ang aming contribution dyan.
Sige sir, maraming salamat po sa mga tanong ninyo. Yun na yung last question. Mikey, sabi nga ni Yusek Rio, yung fake news parang virus. Hindi lang natin alam kung symptomatic o symptomatic. Dapat i-isolate sa quarantine facility.
Tama.
Okay. So, wala nang that's the last question, ladies and gentlemen. Marami pong salamat, Sir Yusek Rio, Yusek Cabrera, Colonel Bayon, of course, our good friend Dr. Ted Esguera, for gracing our show, Philippine COVID-19 Crisis Under the Lenses of DRR Management. I hope may mga may takeaways yung mga nanonood sa atin. And madami ako natutunan ngayon. Sana magamit natin lahat yan. Hindi lang sana magamit. Yung 3U, use, at useful. Yung tatlo na yan. So, Mikey, can we give at least sa mga 20 seconds each panel, last word nila?
Yes, mga final remarks for our participants. Let's start po with Ma'am Vilma. Okay lang po, Ma'am Chen.
Ladies first. Ladies first.
Yung ko lang, I'm the only girl ko, no? It's not, we do this, yung virtual forum on serious national issues. Kung pwedeng damihan pa natin, dalasan natin yung forum na ganito.
We'll do that, ma'am. We'll do that. Thank you very much, ma'am. Thank you. So, Mikey, sino susunod? Ikaw ang
Start tayo sa tatay niyo. Sa tatay niyo.
Sorry. It's your turn, Dad. Yusek Rio, sir.
Ay, lolo. Well, maraming salamat sa nag-organize nito. Yes, it was an honor to be part of to be a resource person, no? Definitely, laudable talaga itong ginawa natin because ito ay part ng information drive ng ating advocacy, no? Tayo ay in the thick and thin of any disaster, no? Na dumaan sa Pilipinas, no? In fact, we are all preparing for the big one, no? Sana hindi dumating. Pero yeah, we have to prepare for it. And some disaster like COVID-19, hindi talaga ito na-predict. Walang nakaalam nito as early as the beginning of this year. Yeah, hindi sinikreto kasi ng China yung nangyari sa Wahoo, no? So yes, this is very helpful in times like this, no? Para ma-assure natin ang ating mga kababayan on the steps to do, katulad ng binigay ni Dr. Isguera at yung mga views ni Yusek Vilma Cabrera and of course si Marlon Bailon, ay ang laki hong nakuha natin ditong mga impormasyon. Pati ako, marami katulad ni Ed, marami rin ako natutunan. Thank you very much.
Thank you, sir. Marami pong salamat, sir, sa pagdalo. Mikey?
Next po is sa brother nyo. Sa older brother. Older
Si
brother.
Marlon yun, Marlon.
Opo, si Sir Marlon.
Thank you. Older, kasi mag-retire na ako ng December eh. Compulsory. Well, foremost, I would like to extend our congratulations sa grupo ni Colonel Edwin Sadang. Of course, especially Kuya Bong Graho, Christopher Graho, the Eric, and of course, to our colleagues sa aking pinagpipitagan, Sir Rio. Sir, nung ako po Chief of Staff ng Health Service Command, tayo po yung magkasama nung pinalakas niyo yung Wi-Fi para sa mga Marawi heroes po. Ako po yung katabi niyo, no?
Okay.
Hindi ako secretary. Palalakasin ko rin yan.
Kay Ma'am Michelle, ako ko nakakasama nung ginawa po natin yung NDRT manual sa Tagaytay. At si Doc Ed, long time no see, CBRN classmate, sir. It was yata 2005, 2006 pa yata yung magkasama tayo nung araw. Then, of course, ang pagbati ko sa successful activity na to na tama yung sabi ng pangkalahatan, sana magkaroon pa tayo ng marami pang itong activity. Dahil ako mismo, hindi na ako nakapag-share, maraming din ako natutunan. Maraming salamat. Stay COVID-free tayo. Ingat tayo palagi at magandang gabi sa lahat.
Thank you, Marlon. Mikey.
And final is yung baby brother. Si Dr.
Nakakabata ang kapatid. Mas gwapo lang ng konti.
Di ko alam kung yung tawa niya, yung bagang the opposite of it eh.
Ikaw, Mikey, kapatid ko yan.
Ang masabi ko lang, I would like to thank our Almighty for pulling us here, interacting. This is a celebration of life. And pangalawa, pinapasalamatan ko yung Panginoon dahil natuwa ko I interact with patriots like you. No, it revived the love to God and country within me when I see you, your efforts, what you have done. Ako susunod lang. Sana patubayan tayo lahat at matulayan pa, humaba pa ang buhay ng nag-organize dito para lagi tayong ma-invite si Colonel Sadang sa Kasibong, si Jim, no? Para lagi tayong mga ganito kasi kung ano ang kasamaan nangyayari sa mundo, dapat higitan ng mga taong ang kaisipan nila ay tungo sa katuwiran at tungo sa ano ang ikakasisiyan ng Diyos at ikagagaan ng taong bayan. So, ako'y karangalan ko po na nasa inyo. Parang it's really an honor na I see people who love God and who love this country. So, lahat ng pagpupuri po sa ating Panginoon.
Thank you, Doc. Mikey, any
And
Sige, bago ako.
final remarks din ako.
Hindi,
Oo.
baka may ano ka,
Ah.
bago ko sabihin yung ano. Oo,
So,
sa akin.
to sum it up lang, so I agree with all our speakers that it's not a blaming game. So, parang dapat tayo, since we all are caught off guard, so hindi lang naman tayo, hindi lang naman ng Philippines. Yun nga, sabi nila, it's globally, di ba? So, instead of blaming other people or the government, let's always remind ourselves that we are all accountable. Diba? So, hindi lang ang government accountable, but us as well. So, lagi tayong maging responsible in all our actions, in all our social media posting, in all our everything. So, kailangan nating maging accountable. So,
Okay.
and final remarks?
Okay.
Sa
The benefit of our owner. Marlon,
Last.
na eh. May bayad na yan, ha?
Nagpapabati lang yung isang mapitagang member ng OCS Class 6, mista mo, si Colonel Edwin Agno.
Okay. So, sir, marami pong salamat sa lahat po sa inyo. Ako po, personally, kung ako magsalita, baka maiyak ako dito because I'm saying this coming from the bottom of my heart. This is not for us anymore. This is for the next generation, our daughters, sons, our granddaughter. We should be shoulder to shoulder doing all these things. Sana magkaisa lahat para labanan itong kasalukuyang digmaan na ating nararanasan. Rest assured that we will be with you sa mga susunod na panahon para yung sinabi ng ating mga kasama. Our honor, it's our honor to be with you, ladies and gentlemen. So, in behalf of the RETT-PH, the last serious question, sir, is coming from Bong Graho. Sincere and serious question from one, Eric Ting. Si Engineer Mikey po ba ay single pa? Available pa? Okay. With that, pag muna sagutin, Mikey, anak, follow ka muna sa tatay mo. Okay. Yusek Rio, Yusek Cabrera, Colonel Bayon, Brother Ted Isguera, mabuhay po tayo lahat with the blessings of our Lord Jesus Christ. Mabuhay po tayo lahat. So, thank you.
Buhay po.
Thank you, everyone.
Thank you.
Bye.
Good night po. Good night.
Salamat.
Good night.
Night.